Well, and so before presenting the site as such that we have developed, I would like to thank the ECLAC Department of Statistics, with whom we've been working very closely, as also within ECLAC, we're moving ahead with the interoperability of the systems within ECLAC, and thank the web unit that did the technological development side and the UN Population Fund that, of course, supported us to be able to work on this. And also, especially thank the GTC, the German Cooperation Agency, and who also supported us with funds to have a team of developers for the web unit and develop the platform. I will briefly review how this came about, this virtual platform, especially for those who are joining the conference process. As the technical secretariat, we received the mandate in 2017 to devise a virtual platform proposal. At the time, we worked on drafting the conceptual and methodological proposal. More than 20 years back, 21, in fact, if it was not in this room, it was in the one below, we presented the system of indicators for the Cairo system, which was quantitative. And since then, and at that time, the indicators, we designed them as the technical secretariat. As I said, it was a system of solely quantitative indicators, and the progress made over the last 20 years led us to rethink other types of tools in order to monitor such a complex and rich and progressive agenda, such as the one that we finally put together. At the third meeting of the Regional Conference on Population and Development, we presented the document, which is on the website. You can see it with a proposal, the conceptual methodological proposal. And it was very well received by governments and the civil society and everyone who took part in the conference at that time. And we were asked to prepare a prototype. The prototype we presented at the fourth meeting of the presiding officers right here in 2019. And so we received observations, comments, and the prototype proposal was accepted. At the time, we had the model. It was a prototype, but we did not have the house as such. But then now what we're going to present is the development based on that original prototype. We had thought of doing it in 2020. We all know what happened. And also, in the face of the health crisis and the pandemic, activities within ECLAC were reprioritized. And in fact, in 2020, the COVID observatory was set up in record time, and which meant that the development of the platform sort of was shelved, but then later it was taken on with great strength and vigor. And so among the main items that conceptually guided the proposal, the idea was to have a tool that shows how countries move ahead in meeting the commitments under the Montevideo Consensus, not only based on quantitative indicators, but also in terms of process. And that is why we're going to see this, all the elements that we have in the platform. And that this were a space so that a diversity of users may, using the platform, follow up on the accountability, the communication and exchange of experiences among countries of the region and out of the region, and that civil society organizations may also perform a certain degree of oversight regarding the actions carried out by the state and that affect everyone, It also allowed using the tool to do regional analysis of progress reported by the countries, among other aims. We also clarified that the platform does not substitute the different observatories or platforms developed at national level, nor the regional platforms furthered by the civil society, such as Mira que te miro, but rather it is a complementary tool to the national systems and what is done by the civil society.
Right now, if you go to the website of ECLAC and Population and Development tab, you will find the link to the platform. And at the same time, if you go into the website of the fourth conference, you will see a virtual platform for the follow-up of the Montevideo Consensus. Now, here we have it. When you click that link, you can see that the platform is both in English and Spanish. Here you have it in English, but I will continue with the Spanish version. What do we have? A text that explains what I have briefly said on the conception and the conceptual aspects and what is behind this platform, which are the goals. And any user can download the document of the Montevideo Consensus, which shows a roadmap. Here we will find some important indicators, then I will explain them a little bit more with the chapters of the Montevideo Consensus. And here, with the idea of creating a synergy with the 2030 agenda, we work with that tool as well. So we mention here which are the sustainable development targets that are linked. We know that everything is interlinked, but we made an effort to select which are the SDGs that are more directly related with each one of the chapters of the Montevideo Consensus, because we understand that this agenda complements and allows to deepen the development on the SDGs. This is the first page, which summarizes elements that you can find in the different sections of the platform. You have the subjects, priority measures, indicators, institutionality, laws and policies, national reports, profiles of countries, documents of the Crpd, and dissemination documents. We will review it very briefly. In the case of the subjects or chapters of the Montevideo Consensus, you will find each one of the chapters and their relationship with the SDGs. And if we click on chapter D, the first thing we have here is a metric, a very simple metric, on the number of countries of the region that are related with all the strategies for sexual and reproductive health. And we have 22 countries. Then I will say which are the data that we have uploaded so far. And that includes laws, policies regarding sexual and reproductive health, and a total of 160 actions. Then we have a summary. Here, we include elements that we already had in previous documents of the conference, and we wanted to give it an interactive life in the platform. It's a summary on the purpose of this chapter. You have all the priority measures and also the indicators. From here, you can have access to the indicators. So if I click one specific priority measure, what we have here in this case regarding this priority measure 34, we have the text of the Montevideo Consensus regarding priority 34, but we take advantage of the operational guide for the implementation of the Montevideo Consensus, where we include elements that appear in the guides regarding each of the priority measures, together with the possible action lines that we propose in order to we proposed at that time to implement that priority measure. So we include something that was in a static document and we refresh all that. And this is what we had proposed in the last years. When we click indicators, we have each of the chapters of the Montevideo Consensus in order. And right now, which are the indicators that you will find in the platform? In this first stage, and this was something that we decided in the meeting of the presiding officers in 2019, in the first stage, we would upload the indicators that coincided. We know that we have about 40 indicators, 43 actually, that coincided with the SDGs. And the decision we made, and this is related with all the work we've done with the Statistics Division of ECLA, was that we needed to have the same indicators that we find today in the follow-up platform for the 2030 agenda. We wouldn't duplicate efforts. And since we are migrating our data bank to Cepalstat, the website on Statistics of ECLA. So what we have here, I will choose any of them. Here we have the list of them. We have all the indicators, the official indicators that were approved during the Montevideo Consensus, prepared by the group, the ad hoc group of countries to propose these 140 indicators. So let us say that we're going to choose an indicator. We are mentioning when the indicator coincides with the SDG, we indicate that. And we will choose the first poverty indication. So now you can see here the graph, our database, that is, the database is the gateway database. So we read in real time, since it's an open database, we will read in real time the information that is already in the ACT gateway in the Cepalstat group, so we won't have contradictions between the figures. That used to happen in indicator systems. Even within ECLAC, depending how you access this, you found different figures for the same indicator because that is related with the different methodologies. We have the technical file and we have the possibility of choosing for Latin America. We can choose Latin America. We want to see the situation of Uruguay, Suriname, Peru. We'll check here child mortality. This is for you to see that this is dynamic and that this works and the graphs are built in real time. So the disaggregations that we have today in the indicators are the same disaggregations that we have in that gateway or Cepalstat. So here first, we have to find out how to continue to make progress regarding disaggregations. I won't analyze in detail the indicator because there are many aspects, but I just want to show you how the platform works. And we have that for each of the indicators. What happens with those indicators for which we know that we do not have metadata or these qualitative indicators that are related with, for instance, I will show you one I have here, that have to do with the existence of development plans included in the demographic projections. This indicator, existence of, well, we could take it from a quantitative point of view, but we have not uploaded information. So when there's no information, on the one side, we give the definition of the indicators according to the last document to remember what is it that we want to measure with this indicator. And on the other side, if this indicator is associated to national tools, then I will show you how we have a classification of these tools that allows me to filter and to include here all the development plans. So we do not know if these plans that appear here incorporate population projections, but at least I've filtered it from the policies database to associate them to this indicator. And now we, of course, have to continue to work on this as soon as we conclude this conference. And afterwards, I will speak in more detail about that. And like that, we could check all the indicators. You will find the graphs that are directly linked with SDG or SEPAR-STAR or the metadata or a filter when it is related with the public policy. Here we have the institutionality section, and the purpose here is to make available the institutionality created in the country to implement and do the follow-up of the Montevideo Consensus. So we also have very simple metrics that you can improve as we include more characteristics in the institutionality. 25 countries have an institutionality, 16 in Latin America and 9 in the Caribbean. And of course, we can check these countries, the institutionality of these countries. We can know whether there is a legal backup to this institutionality. So if we go to the plurinational state of Bolivia, we will find which is the constitutionality, the Development and Planning Ministry with a link to the ministry. We have download from here the document that includes the legal backup, the Supreme Decree that gave rise to that backup, and a brief description of that institutions or institutionality. As I said before, with the updating proposal, we can expand the description of the institutionality as we obtain different characteristics. For instance, if the institutionality includes or not participative mechanisms for the civil society. What we have included now is what the countries reported in the last national voluntary reports. So an updating process is coming up. Regarding laws and policies, the first thing we have is a counter for how many laws and policies we have registered. I have to explain this text. These 1,955 actions are the ones that the countries reported in their last voluntary reports. We took the voluntary reports one by one. We built gigantic matrices, and well, the original proposal was much more modest. We wanted to have a repository filtering by country and by year. But when we saw the richness that we had in the database and the actions reported by the governments in terms to be able to do a deeper analysis regarding the type of policies, what we did was that for each of these 1,955 policies, we determined with what chapter of the Montevideo Consensus they were associated and with which priority measures. In the case of some countries, the voluntary reports were made following the chapters and the priorities, and that facilitated the work for us. Some didn't follow that format, and you had to go into the websites, the policy documents, analyze them, and then create this classification. Why is this classification so rich? Because thanks to that classification, the first thing I can see here to the left is the number of actions that I have for each one of the Montevideo Consensus. Even though I won't make a qualitative analysis yet in terms of what type of policy I have, at least clearly I can see a certain prioritization of actions.
In that, we have 496 policies for the childhood and adolescents and youth, and only 34 for Afro-descending. Now, the number is telling me something. Of course, I can have an Afro-descending policy that is very powerful, and you don't need to have 1,000. But this is revealing something. And so what we want. And also, here we can filter and screen by countries. For, let us see, Colombia, how many policies are reported in its last national report? 106 policies. And in the case of Colombia, look, migration would be the last one. And childhood, youth, and adolescence is the chapter with most number of reported national actions. And of course, in this screen, we have those policies. Therefore, I can access them, go into in greater detail, and I can screen by country and also by priority measures. I could search by that. I can choose territory and coexistence. And here I have the 9 actions that refer to this priority measure. So we add, why the importance of this ranking or classification? Because afterwards I can build sophisticated metrics easily will tell us something else. For example, the average, the regional average of priority measures covered by each one of the chapters of the Montevideo Consensus, or percentage of covered measured. Or you could say, look, let us Uruguay, look, 100% of prioritary aging measures covered. We could see what types of policies Uruguay has on aging. The metrics can be sophisticated, made even more sophisticated, to the extent that we have measures reported by countries. Then we have voluntary national reports, where another counter telling us that 95% presented a report, 16 of Latin America, and 9 of the Caribbean. And of course, accessing to each one of the reports according to the date of submission. Here you have the report of Brazil, submitted in 2018. That's the link, and you can download. In the case of country sections, what we do there is build a profile that is automatically prepared based on previous sections. That is, will give us a summarized idea of what are the institutions of a country, what are the measures, what are the graphs. For example, I'll go into Chile. And then we have, for Chile, what's the institutionality, what the coordinator committee of the consensus, there is a voluntary national report, how many reports submitted. So I have a couple of other outstanding indicators. I can change them, but they're the same ones that are already in the module of indicators. And what it does, it builds them exclusively for Chile in this case. It facilitates access, but it's the same information. And the last instruments policies, programs, and laws that Chile has chronologically ordered them, and some outstanding documents that, once again, this will be perfected or improved upon to the extent that we include more content in the platform. We also have the section of documents of RPDs. CRPD. Here we only find the official documents of the conference, Regional Conference on Population and Development, because ECLAC has the official webpage of each one of the conferences, but we wanted not to go to the ECLAC web where sometimes documents have a different classification, working documents, position documents, reference documents, and sometimes the user doesn't know which one it is. What they want to find is the guide for the consensus. They want to find is the resolution. So what we did was obviously the information we upload to the web has a classification that we consider it's a bit more user-friendly. And we have, on the one hand, all the official documents of the conference, which are methodological, all the regional reports submitted. We have the voluntary reports, the decisions and agreements, all of them are together, so I don't need to go year by year looking for each one. I have them all chronologically ordered, and the reports of each one of the conference that we need to prepare as technical secretariat. And I can search by type of document, but eventually the functionalities, and we can continue developing them. You can add one more filter per year, or you can develop new functionalities. And finally, however, equally important is this section on dissemination resources. This is very important because it will allow that from countries may disseminate, communicate, convey documents, news, videos, interviews, infograms that have directly or are directly related to the implementation and follow-up and monitoring of the Montevideo Consensus. And therefore they may be government documents, international agency documents, civil society documents. Therefore, a space where, to the extent that you tell us, we may be able to publish everything that is being done in the countries, in the regional networks, sub-regional networks. And for example, if you see here, we can access now the control table of Montevideo Consensus of Peru. Also, we can access the report prepared by Mexico. Here we have, chronologically speaking, all that we are uploading. Mira que te miro, we can access. Of course, here we are publishing the last publications of ECLAC, or that we do related to the Montevideo Consensus. We have quite a lot of material, and also we can do a filter. For example, if what we want is to see videos, we use the filter and the videos. For example, here we have one of Caribbean. It has to do with the consensus, and we need to continue updating. This is our platform, our virtual platform. It's in the web. You can navigate, you can connect. Now, you will see that we also presented the document with the proposal and protocol for updating of the platform. So the direct responsibility of updating this platform is in CELADE as a technical secretariat. But of course, we need to do this among everyone, with all of you. So, and I will go over the different section. Insofar as topics and priority measures is quite static and be updated. For example, if we describe the main objective of each one of the chapters, given that the consensus was prepared in 2013 and still the 2030 agenda did not exist, we refer to the millennial goals. Yes, of course, we updated it, but the content is quite static. And if we see a priority measure and we have the action lines that are in the operational guide, and we wanted to add new action lines, we can also update that content. But the most complex and hardcore content are the one of indicators, institutions, national laws and policies. I mark them in green here because this is permanent updating, permanently. As to indicators, we will continue to work with the statistical division. We will need to consider the disaggregations, and thanks to UNFPA's support, we will be having in Sepalstat information on Afro-descending peoples and migration. So we will have this dynamic interoperability, and we will be working on all these subjects. But indeed, we will need to continue working with the country group. In institutions, national laws and policies, we are considering a survey that would be conducted biennially, where we as technical secretariat not be the one to classify what are the priority measures or what chapter of the Montevideo Consensus is involved, but rather the governments themselves present the classification and present the indicators so as to avoid biases or incomplete information. So we prefer governments provided. And so you can see you have the annex and the proposal of the survey that we are sending to each country from here to the end of the year. And tell you that the idea is every 2 years the survey, but if a country in the middle of that period modifies its institution to focal points, and we can, it's not that they need to wait 2 years for changing institutionality of a country, or they say if you want to report policies or laws. These days, we've heard a lot of progress of policies implemented through different governments, and we know that our site is 2019. We need to update the platform with all the regional measures adopted. And the fact that once we apply the survey, that will be useful for national reports. Everything is complementary. To respond to the survey will later on facilitate the preparation of the voluntary national report. You will have the information already systematic there. So the report and platform will be synergistic. And then we have the national reports that will be uploaded to the platform. That's the calendar that of national reports. The country contents, it's not very complex. It is automatically updated, and the documents of the conference will be uploaded by us as technical secretariat on a permanent manner. We'll be uploading the documents to the platform, and the issue of dissemination resources. Well, we have a short protocol that I will now explain. So,
what is important of the elements? The survey is important. Why? Because our idea is to be able to, since conceptually the surveys has been already proposed that the survey would have the A component, institutionality, and second component, laws and policies. And the idea is to gather more features from institutionality. If you go into institutionality, you're going to see the summaries, but we need to have more features. For by example, that we need to know how the institutional mechanism operates when there is this mechanism for the follow-up and implementation of the Montevideo Protocol. And then have information on coordination task of this institutional mechanism that tell us how the civil society could participate in this mechanism of the implementation of the Montevideo Consensus. To the extent that we have this information, we will be able to incorporate this in the platform. As to laws and policies, the idea is to have more features relating to creation type of policy, beneficiaries, territorial reach, timing, general objective, links to documents. All this will make this site much more rich. And I want to highlight and stress how important it is to prepare this classification of the Montevideo Consensus chapter for each law and policy or action and policy, because a policy can respond to consensus. If we need to be selective, what are the chapters that are directly related to the action, and what are priority measures? Because this will allow us to calculate metrics that will facilitate the read and follow-up. About dissemination resources, it is about sending the interest to technical secretariats through this email, who will then we will give them back a form that they have to fill in the minimum information that we do need to upload into the platform, dissemination resources that you want to share in this space. Finally, what are the next steps? The idea is to fill the survey, the online survey this year, no paper used. Our expectation is a full commitment and active participation of the countries in the region, because we can develop a site with much more complex functionalities. This is like Regatta. Today we interact with R, with Python, and all these new systems and platforms. But if we put together a population census, we cannot perform miracles. We can develop a lot of functionalities, but I think the great challenge that we have right now is how can we update contents so each country can see everything that they are doing. So it's not only stayed in this space when they come with a statement, but what we expect here is to work in strong coordination with the UN FPA mainly, but all the support that we can receive from the UN FPA national bureaus, depending on each country, because it depends how they want to use the survey. For the country that needs support, national UNFPA officers should or willing to support, and how? Again, with this participatory logic, not a closed door from the cabinet. We want to put a lot in force, the structure, the technological development, and also continue to work with the countries. So this is why we are proposing that the task force on indicators become today a task force for the virtual follow-up platform under the lead of the excellent lead of Mexico in their role as the task force coordinator, as they have done with indicators, and we can build together this update protocol. I stop here and thank you very much. I want to open the floor with the collaboration of the Secretary to listen to interventions of delegation on this point. We give the floor to interventions. Thank you. We'll give the floor to representative of Argentina. Thank you, Mr. President. First, let me congratulate ICLAC and CELADE and UNFPA for this significant progress for the whole region. And also we consider that Argentina strategic tool to know how much we have progress, where are we, and what can we do. It can also serve as an alert on some themes that are a little stagnant. In this context, and based on what we have listened these days, we want to reaffirm the importance of having a statistical information system starting from administrative records, not a competition for census, but more as a supplement or a complement for censuses. We are working, they are not valued, but anyway, it's a very valuable resource for designing public policies and evaluate the quality of life of population. I want to mention some progress that we have made in our country during the pandemics. In the national population direction, we are setting up statistic information using administrative data, using all type of data of the population, nationality, death, birth, etc. And currently we are in a very complex situation, which is building information on internal mobility of the population. That directly relates to what we are working in the Ministry of the Interior in policies of federal regional development. It will be a very significant input in order to measure what are our progress in this sense. During the pandemic, this system played a very important role because we could answer rapidly to the spontaneous demand of information. This is a system that we started in 2020. There was nothing before that. It was complex, but it allowed us to give rapid response to the information requested by municipalities and provinces. We put together a geolocalized population pattern. It was essential to plan the geographic distribution of vaccines and segment according to population groups in the different territories that made up our country. We also generate studies and spontaneous report due to the urgency of pandemics and to respond to urgencies or emergency situation, mortality risk situation, also using a geo-reference basis. So now we are providing support to territorial operation in more vulnerable areas and to provide information to civil society, municipalities, etc. We are very happy, yes, because in little time and with a lot of effort, we have been able to provide responses or react at critical times. This information system is scalable, and the objective is to integrate different source data to characterize our population from a multidimensional approach. And we want to invite the countries in the region to join efforts to work together in building this type of systems, sharing experiences, because we know that the task is very complex, but together we can overcome obstacles. In Argentina, we put at your disposal to move forward in this path. Thank you very much. We want to thank the intervention of the delegation of Argentina, and we continue with the delegation of Paraguay. Thank you, Mr. President. Only to appreciate and be grateful of the effort made by ICLAC and CELADE to prepare this platform that, as was indicated by our colleague in Argentina, becomes an incredible, essential tool for following up the Montevideo Consensus. We thank the intervention of the delegation of Paraguay, and we continue with the delegation of Chile. Thank you, Mr. President. Good morning to all of you. And first, I want to thank Fabiana for her presentation of this platform. And really, we support all the work conducted by CELADE all through this year to be able to create this virtual platform that would allow us to follow up the Montevideo Consensus. This is a space that will allow us as a countries to disseminate the progress and also challenges in this connection. Also, my appreciation also to the collaborative work with the Statistical Conference of the Americas to use the statistic using as source the information that is already available in ICLAC, and also the information available on regional platform on the follow-up of the Agenda 2030, considering the high coincidence in the follow-up indicators for both development agenda. As statistical communities, is also challenged to be able to meet production indicators that allow us to show follow-up and progress made in the implementation of public policy of each one of our countries. This is why I want to express the need to continue to have CELADE's technical accompaniment and technical advice and ICLAC for the use of the platform and the calculation of indicators required for the follow-up of the Montevideo Consensus, and develop capacity in the country for the production, use, and spread of socio-demographic information for establishing public policies at the different levels and sectors. It is crucial. Finally, and we hope that we will be able to use in this space, and we will be able to work together as a country to have this updated space and introduce improvement proposed by Fabiana, and As our colleague from Argentina commented, we will be able to learn from other experiences, and we will be able to show our own advances. We thank the intervention of the representative of Chile, and now we're giving the floor to República Dominicana.
Thank you very much, Chairman. I too join in the congratulations offered by the preceding speakers regarding the work done by CELADE to the platform, and also the synergies among UN subsidiary bodies. This is very relevant, and we should not only leave no one behind, but also the interagency work hand in hand with UNFPA in the process. I would like to call your attention to the theme of continuity. And the last slide shared, Fabiana, of the active commitment that countries must have. And above all, take into account, I believe I mentioned this in my two previous interventions, this cannot be something in parallel to national planning tools. They must be very much hand in hand, interacting with the monitoring and follow-up of policies, because one of the things that we're doing in the Dominican Republic and since the new government took office in 2020 has to do with the internal planning, putting your home in order and then not have different ways of moving ahead in meeting international commitments and national commitments as well. I think that here the call is, as UNFPA was saying, the support that in the case of the Dominican Republic has been offered for this process, especially the Ministry for Planning, but also look for coordinated work with the national statistics offices so as to follow up on this. And there's one theme that is of concern to me, and that is with regard to the indicators. We every year answer several surveys from different agencies that are custodians of indicators. So there, we must always try to ensure that interoperability, so that if there are indicators that are picked up under SDG 5, well, let's not collect them once again elsewhere. We should always take care with that, because it's a burden of work, not only for the countries when we need to use and do other things. For my part, I do back the platform, and above all, that we may really use it for the purposes that you have recommended. Thank you. Well, we thank the Dominican Republic for their statement, and now we'll move on to the Delegation of Mexico. Thank you, Chairman. First of all, I would like to congratulate Fabiana del Populo and the CELADE Demography team for the construction of this very robust and useful tool that will surely allow us to better follow up on the Montevideo Consensus. I believe that it will truly be a very useful tool. Second, I would like to express my gratitude in confirming Mexico to continue with the working group that used to be on indicators and now follow-up of the regional platform. We were pleased to accept this responsibility, and we thank the trust placed in us. In Mexico, or very recently, we were able to do a platform with the Office of Human Rights of the Government Secretariat and the Autonomous University of Mexico in order to follow up on indicators in the country. And this too will help us better follow up internally, and also it will be easier for us to upload our indicators to the regional platform. So many congratulations and thank you for your trust. We will be there. We thank Mexico for their statement, and now we recognize the delegation of Cuba. Yes, good morning, and thank you, Chairman. This is a great step ahead. I think it has already been said, the preceding delegations have said it, and above all, for those of us who for years have been working with Mexico on this group of indicators, that was first very difficult. Metadata was tremendous. How can we do this? So having this platform allows us not to repeat things that have been said already, to disseminate, socialize, all learn from all, and the link with the Statistical Conference of the Americas and the Statistics Office, or Division rather, of ECLAC, that last week Ms. Director Ocampo visited us and had spoken to us about this, and we were very happy. But sometimes we're asked when the groups get together for the following up on the Montevideo consensus and people say to us, and how about the other countries? And what is there? And what do we have? And what should we do? Well, we need to start working on this now. But it is definitely a major step ahead, and that allows us to be better positioned with a better integration within ECLAC and also toward our country. So as my Mexican colleague said, I join in the congratulations for the Secretariat and especially Fabiana and her team for what has been presented this morning. Thank you. We thank the Mexican delegation for their statement, and now the delegation of Costa Rica is recognized online. Thank you. Good morning, Chairman and attendants. I too join in the words of thanks expressed by the colleagues from Argentina and all the way to Cuba for this excellent platform that allows us to move ahead with the follow-up of the indicators of the Montevideo Consensus implementation. For Costa Rica, this is very relevant. Since 2017, we have been working with CELADE recommendation and CONAVI in Mexico in order to work on the indicators, and we're hoping to very soon be able to make official the system that we have drafted here in the country, and so contribute to the platform, and in the same way as the platform will contribute to us, and that all other member countries may see this as a praiseworthy and accessible tool, because this tool that we are drafting is easy to use and free of charge. And so we can work with different administrations, all branches, the legislative, executive, and the judiciary. The system of indicators of the Montevideo Consensus will be positioned within the national statistics system based on the National Statistical Office. And this leads to decision-making with regard to all policies in the country. Thank you. Well, we thank the delegation of Costa Rica for that statement. And now the delegation of Venezuela is recognized. Thank you, Chairman. Well, very briefly, I would merely like to thank CELADE for the presentation and the platform presented to follow up on the Montevideo Consensus. For our part, UCA please accept our support. This is a platform that also allows us to work coherently with our development plan, very much linked to the 2030 agenda, and allows us to make the efforts made jointly in order to follow up on the consensus and, of course, these actions carried out within the country. For our side, we also like to thank the support by UNFPA as well as CELADE and DECLAC within the construction of the national statistics model that we've been putting together as the cornerstone of the system that has to do with a micro locality where the statistical fact occurs and where the phenomenon is recorded and the statistics that we present in the entire system. And so being able to connect that information with the platform will be great achievement for our country and add to the joint work that we've been carrying out with CELADE, ECLAC, and UNFPA. So we thank you for the development so far. Thank you. Well, we thank the Delegation of Venezuela for their statement, and now I introduce Enrique Peláez, researcher of the Center for Research and Studies on Culture and Society in the purview of the National Council for Scientific and Technical Research, CONICET, and the National University of Córdoba, Argentina, who will speak to us and moderate Panel 1, Population and Development, the Effects of the Pandemic on the Region's Population Dynamics. Well, thank you very much, Chairman. And it is an honor for me to moderate this next session on population and development, the effects of the pandemic on the region's population dynamics, a theme that was already seen on Tuesday in the excellent presentation by the director of CELADE, Simone Cecchini, speaking on the book of the social demographic effects of the pandemic in Latin America and the Caribbean, and a matter that is of particular concern to demographers, mortality, fertility, and migration. As this was said in the presentation on Tuesday, Latin America and the Caribbean has unfortunately been the region with the highest proportion of deaths due to COVID-19, almost 18%, when the Western population represents only 8%. And the particular characteristics of our region in terms of inequalities, both social as well as economic, there lies the key of this. So we will have 4 presentations, each one. I ask the panelists to please keep to the time, no more than 15 minutes, and then we will have comments by the delegations. So, first of all, a presentation by Alafia Samuels, Honorary Professor at the Caribbean Institute of Research and Health, University of the West Indies, Jamaica. And Alafia will speak to us about the particular characteristics of the impact of the COVID-19 pandemic on the Caribbean region.
Alafia, you have 15 minutes. Welcome. I think we cannot hear you. I think the sound is not good.
Can you give me 1 minute? Let me move closer to my router. Feedback will improve things. Give me 1 second, please.
Buen día, por acá de STIC. Perdimos la conexión de la señora Alif Alafia. Si pueden continuar. Creo que tiene mal internet y bastante mal su audio.
Ok, muchas gracias. Entonces vamos a comenzar con la...
Sorry, she has a poor internet connection.
Presenta como las otras variables. Primero es la variable que naturalmente vemos el impacto de la pandemia, lo que dije hace un ratito del número de funciones, pero tiene muchos desafíos el tema del estudio de la mortalidad por la comparabilidad de los datos entre los países, problemas en la cobertura, por problemas en la calidad de...
We have problems in the quality of the sources. So we will have the presentation by Dr. Marcia Castro, Impact on Mortality and Overall Health. She is Professor of Demography and Population and Development from the Public Medical School of Harvard. Marcia, you have the floor.
Okay, good morning. Thank you. First of all, I want to thank the invitation. I'm really honored to be here. And second, apologies. I'm from Brazil, but I don't speak Spanish, so I'm going to stick to English. So in talking about mortality, the first thing I want to mention is that we do observe across the countries both direct and indirect effects of the pandemic. The direct are pretty straightforward. Those are the deaths due to COVID. Some of them are hidden because they were miscoded or because countries didn't have enough testing potential, so they didn't get coded as COVID. But the indirect effects can be tricky because they can either increase the other causes of death. For example, people died during the pandemic because of the pandemic, but not from COVID. So this is people that had an emergency, didn't go to the hospital, the hospital system collapsed and so on. So I'll talk more about this. But we also have another type of indirect effects that can decrease other causes of death. And that's what usually we call in population studies as competing risks or harvesting. So those are the people that probably would die that year, but die of another cause, not die of COVID, not of the other cause. So we can have a decrease in other causes of death. Which one wins the game, increase or decrease? It's different across the countries, and I'll show some examples. There's a timeline of that. Some of those effects are immediate. That's happened, and unfortunately we have to count them. But there's also a sort of a long-term effect. And the long-term effect is because of the deteriorating conditions of overall health. And those happen first and foremost because of long COVID. And I'll talk more about this. We're still learning a lot about the duration and the intensity of the consequences. Poverty is up. Hunger is up. Just in Brazil, it's 33 million people facing severe hunger last year. We have all the consequences of procedures that were postponed, disruption of primary care, people that are having late diagnosis of COVID. For example, the number of mammograms that were not performed because of what happened in the hospital system during the pandemic. We're still going to see those consequences. And many conditions that are often amenable to primary care that now we're seeing the consequences. One of them, for example, is diabetes. Needless to say, this has been discussed a lot, and it should be in the past 2 days, all the consequences for reproductive health. And I'll just mention one, maternal mortality is huge in Latin America during the pandemic. Again, there is a timeline for the deterioration in overall health. Some of this is immediate. The long term is a big unknown, and I'll go back to that at the end. So there are different ways we can measure those consequences. One is just to look at excess deaths. We saw some of those numbers in the first day when the report was presented. This is an estimate that was released recently by the World Health Organization. For the region of the Americas, it's 3.23 million excess deaths that happened between 20 and 21. There is a huge difference across countries. So anything we talk about Latin America, there is differences between countries and within countries, and those are extremely important to be able to see. I only selected 3 countries here, Brazil, Mexico, and Peru. You can see on the top graph the complete deviation from the expected pattern in terms of number of deaths. And in the bottom, what you can see is that this deviation really follows the trajectory of the pandemic, of the COVID deaths. Now, if we just look at the magnitude of the excess mortality, needless to say, Brazil has the large numbers. In fact, 21% of all the excess mortality in the region is in Brazil, 19% in Mexico, 90% in Peru. But any of those numbers have to be looked in the context of where they happen. So if we look at this excess mortality per 100,000 people, then we can see that the burden in Peru was much higher. I just want to make sure all those numbers are horrible and dramatic for the countries, but once we look into the context, the burden in Peru was very different than the burden in Brazil and Mexico. It's important to keep in mind there's also differences when we look in a country. These are preliminary results from a study that we're just finishing where we compare the COVID mortality per 100,000 people and excess mortality by health regions in Brazil, also per 100 people. All the blue colors are health regions where we had both high COVID mortality and high excess mortality per 100 people. But you can see the sort of pale colors where we had high excess mortality and not so high COVID deaths. And that's the indirect effects playing out in the different regions. And this is because of the local context, because how the response played out, the level of comorbidities, a long list of variables that we do need to look at. Because if we're going to put any policies in place to mitigate those effects, we have to go subnational and we have to look at the different levels of sex, age, gender, and so on. This is just one a segment of a graph that a study that we're also doing, looking at how some causes of death changed for particular age groups. And here I compare Brazil and US. And one thing we can see is cardiovascular diseases went up in the US, they went down in Brazil. And respiratory conditions also went down in Brazil, and in the US, it depends on the age group. Those are just two examples, but there are many differences on how other causes of death changed in the context of the pandemic, and we need to the best way possible, depending on data availability and data quality, be able to address them. Now, another way to look at this, and we've seen some of those numbers, is to look at life expectancy at birth. And here are results from one study published recently that basically came up with estimates of changes in life expectancy, both for 2020 and 2021. And basically the estimate is that for the entire world, the decline in 1920 was about 0.92 years and the decline in 21, 0.72 years. I just brought the numbers from that particular study for the 3 countries I mentioned before. One thing I want to highlight is we're going to see many different numbers of declines in life expectancy. It depends on the methodology, the method matters. It also depends on the data source. So I did some estimates for Brazil. I have slightly different numbers, but regardless of the precise number, the signal that those numbers bring is what is important. There was a huge burden, there was a huge decline, and countries are really off track in the gains in life expectancy that we've been seeing in the last decades. Again, once we look at one number for a country in Latin America, we got to go subnational because there are going to be inequalities that must be addressed. And here is, again, Brazil. This is a study that I did looking at the declines in life expectancy. And here I compare both at birth and age 65. And the reason I'm showing this is because the highest declines were in the Amazon region. So the state all the way up left that is blue, that has the acronym AM, that's Amazonas. It was all over the news last year. You probably remember that's the state that the hospital run out of oxygen. So the decline in life expectancy at birth in that particular state is 2.6 times the decline in Brazil. So we gotta look at those subnational differences and also population group differences that are also important. Now, going to the overall health, this is from a report published by PAHO, and here you see some of the declines in overall health services in 2021. This is the percentage of countries in Latin America and the Caribbean that had some kind of disruption. And I call your attention, so all of them are bad news, but I call your attention to the second one, which is the disruption in primary care. So 55% of the countries in Latin America and Caribbean in 2021 had some disruption in primary care. And what that means is a lot of the issues related to child health, women's health, diabetes care, aging care are going to be compromised. Now, let me show you one example. That's a study published recently in Nature Medicine that look at outpatient visits in several countries, 22 countries. Mexico is one of them. The top bar, the top line, the green line is what you would expect if the overall temporal patterns would persist. The red line is the trend that was observed in the first 6 months of the pandemic. And the blue bar, the last one, the blue line, the last one is the last quarter of 2020, when they expected that some of the services would be resumed. Clearly, they were not. So that's just one example, but that's the situation that we saw across the region, a major decline. And again, that has implications for the health status of the population. Now, one thing that has not been mentioned here yet, it's the issue of organ transplantation. That's a study published recently in the Lancet. They analyzed 20 countries or so. And I want to catch your attention to both Argentina and Chile. From Latin America, I think they analyzed 3 countries. And in Argentina, it's about 60% reduction in transplantation. Chile was about 54%. Kidney was the most severely impacted. But overall, in looking at all the patients in the wait list, they estimate about 48,000 patient life years lost because of the postponement of the transplants. So another thing to keep in mind. Now, let me talk a little bit about long COVID. I think this is extremely important. We are not seeing enough responses in countries, for example, trying to actively search people that survived COVID. I think there are a lot of people with symptoms, with some conditions that they're not even associated to long COVID yet. But the key issue here is long COVID affects multiple organs, and people can have compromise in multiple organs at the same time. They can last for months. They can last for even more than a year. And we have very few cohort studies in Latin America to be able to really understand. Most of those studies come from the UK, from the US, and some other European countries. There's one that I know of in Sao Paulo. So let me show you 2 studies that to me are the most important ones to convey the message. This is the most recent one published about a month ago. And this one looks at the risk of dying and the excess burden of deaths per 1,000 people in the population for different conditions of different organ systems. So the very top is just death of people that had COVID compared to people that didn't have, and then the different organ systems. The different colors, green is people that had COVID and did not need hospitalization. Purple, they had COVID and were hospitalized, and orange, they had to go to an ICU. The message here, folks, is that compared to people that didn't have COVID, the risk of dying and the burden of deaths is much higher on people that develop long COVID, irrespective if you need hospitalization. Of course, it's higher if you went to an ICU, but even people that were not hospitalized have a higher risk. This is another one that look specifically at cardiovascular conditions, and the message is exactly the same. So we have broad conditions and then very specific diseases on the right. And again, for all of them, the risk is higher for people that had long COVID compared to those that didn't have. Again, this is going to hit the health systems first as morbidity, And then those people are dying prematurely because of long COVID. So let me finish with some reflections. So first of all, I think we still have some uncertainties, but those uncertainties should be a motivation to try to get better data, try to pursue further analysis. So we don't know for how long the consequences of all those disruptions in the health system will persist. Honestly, that depends on the mitigation policies that countries put in place. We have a huge unmet need for mental health care, huge, and we still have a lot of stigma. So we're not really providing the kind of care that we should be providing, particularly to the most vulnerable population. Hunger is back, and the inequalities are increasing. To what extent policies are going to be put in place with an eye to inequalities to really decrease the gap between the haves and the have-nots. And again, the big question mark to me is what's going to be the consequence of long COVID in the region, both in terms of morbidity, and that's a pressure in the health system, but also in terms of mortality, which really could compromise how fast countries go back to the trajectory of increasing life expectancy that we had before. Now, those are uncertainties. I think all of us would agree that two things we can say for sure. We need health systems to be strengthened. We need primary care in the country. So it's not so true anymore, but if we look back in the first 30 years of the health system in Brazil, that's the proof that a universal health system with a strong primary care can have a direct effect on health outcomes. And another example is Costa Rica, that through primary care has the highest life expectancy in Latin America because of that. And I think the second thing that for sure is that we need to do analysis in a right-based approach. In other words, the moment public health and demography walk hand to hand with human rights is when we have analysis that are detailed by age, sex, gender, geography, and so on. And what we need right now is really to be able to come up with policies that have an eye to inequality and decrease the gaps that were furthered by the pandemic. And that's, in fact, the essence of fulfilling the Montevideo consensus. So with that, I thank you. Gracias. Obrigada.
Thank you, Marcia. Excellent presentation, emphasizing disaggregations and inequalities and the importance of universal public health. And this coming and going back of COVID with many other pathologies that have grown and in Latin America and the Caribbean. So it's important to have all those measures strengthened in regarding access to health.
I hope we have a better connection now. So you have your 15 minutes to talk about the impact of the COVID in the Caribbean.
Yes, I thank you very much. Presentation, which is on my desktop, and I had it a while ago. Let's see if I can bring it up. Yes. Are you able to see my presentation now? Can you see my presentation? Can you hear me at all? Oh no. Can you hear me?
No. I think if you can close your camera. I think the problem is the sound. If you can get closer to the microphone. We cannot hear good. Sorry, Alafia, we will continue with the other presentation and we will try a minute later. Ok, vamos a continuar.
We will continue. We are somewhat behind time. We'll have a presentation on the impact of the pandemic in fertility. And once again, there we have the problem of data, and usually data arrive later than those of mortality, but the first studies show changes regarding preferences. Some women that due to the socioeconomic situation decide to postpone reproduction, and then the inequalities of Latin America, what Marcia was saying, difficulty in access to health services, sexual and reproductive services that could have a strong impact in the inequalities. So I will recognize Ana Cristina González Vélez. She's an investigator, an expert in gender affairs. She's a consultant of UNFPA and professor of law in Los Andes University. I'll take off my face mask. This morning I had a small incident in my lips and maybe some blood could come out, but don't worry, it's fine. I want to thank Celade for inviting me to be part of this panel. And I took this very seriously. I went over the information and hopefully make some comments critically that will enrich the conversation, and I'll try to answer the 4 questions. I will connect them one with the other. I will start speaking about how the pandemic affected reproductive health and fertility. In the document, apparently there is no increase of fertility as a result of the pandemic. As we know from theoretical frameworks and evidence, and apparently goes down due to crisis and uncertainty. But the document says that we need to be careful because we don't know the differences by territories or groups. Likewise, the document explains that the 2 paths that affected fertility were the changes on the demand, not having children because of the uncertainty, and intermediate variables were all focused, and where you have a sexual activity, access to methods, and abortion. And the document says that the effects of the pandemic are differentially expressed depending on the structural inequalities, socioeconomic, gender, life cycle, and ethnic racial inequalities. I would like to refer to some elements to present our critical view, the focus in fertility and the final effect, with that the critical effects on other indicators of reproductive health are missed. It is an opportunity to think about the tensions generated by the agenda regarding socio-demographic aspects and difficulties that we have to integrate them more. Reproductive health is scattered throughout the document, sometimes focusing in the youth, in Afros, in women, but it's invisible in other chapters. There are absent issues like HIV. In spite, the document says that the most important impact comes from the disruption of reproductive health services generated by the pandemic that could reduce access to methods or safe abortion. The effect of the pandemic would be to increase fertility, undesired fertility, and that is a flagrant violation. Sorry, the microphone helped. The flagrant breach of sexual and reproductive rights. And what I think is happening here is that possibly, as the report says, today there is a decrease in global fertility, but to have a rise in undesired, unwanted fertility, or in some groups, it would be important to expand the analysis to see the observed figure, the desired figure, and in a region like ours where you have high unwanted pregnancy rates. In some countries, it's 50 or more percent. And I'm referring to the possibility of addressing the quality of that fertility, which is an expression to say how much of that fertility complies with the kind of promise of privileging and protecting the rights. In a study conducted in Colombia in 2015, we had already observed that the percentage of unwanted children by women in the adolescent group from 15 to 19 was almost 70%. And this was almost twice the unwanted percentage in all women from 15 to 19, reflecting unconsented sexual relations, non-contraception, possibilities, and inequalities. In fact, if we compare the poorest quintile and the richest quintile, we can see that in the poorest adolescents, 43%, those from 15 to 19 years, wanted that first child, and only 14% of the highest percentile did not. So we need to take the results with care, and in a study on the effects of COVID on reproductive health, the guarantee of these rights are highly dependent on time. The effects on one aspect produce a cascade of impacts. The non-use of contraceptives will generate an impact on undesired pregnancies, and these effects accumulate, producing cascades. And so we see a reduction in access to contraceptive methods, 45% in those girls from 10 to 14. And then it shows us that in the second semester of this year, there was an increase of 22.2% of births in this age group. To think about reproductive health, we need to think that there has been a reduction of access to methods, as I've said. In the case of the study in Colombia, the general estimate shows a 28% reduction at the expense of almost all municipalities of the country, and 20% in access to abortion. We don't know how much of that reduction of access to contraceptive methods, how long will it persist in time? And we know that the information on abortion is under-registered, imprecise, and it's more difficult for it to be known, and even that we know how much did abortion contributed with drugs.
Those results that are shown about fertility, what we do know is that significant changes in other indicators that are impacted by the problems that I indicated. And this is serious because time factor is determinant, is essential. There's a time to prevent abuse and violence, a time to prevent emergency contraception and abortion, and then it's only the time for women, increasing of unpaid work, and the impact in the life of women is incredible and enormous. These unequal impacts regarding fertility and reproductive health indicators are clear in the case of Colombia. In mother mortality, female mortality increased, but in the group of 14 to 10, the increase was 126.2%. Indigenous women, the increase was only 23%. the mortality is 4 times higher than compared with other group. And the same applies to Afro-descendant Palenquera population. Same with congenital syphilis that increased 48% in the country, and clearly at the expense of 276 municipalities, so 25% of the total municipalities in the country. There are also very dramatic impacts in other sexual reproductive indicators and focused in some types of group of population or municipalities. Same applies to abortion. There is a 20% reduction, but at the expense of surgical treatment and not medical treatment for abortion. That shows that there are other elements. Beyond those figures, the regional alert system shows an increase in alert of almost 35%, vulneration of sexual rights with 5 clear pattern, mortality, criminalization. Before starting the conference, we presented 3 cases that show how the recent law for causes in violation will prevent that 95% of victims of violence will have access to abortion in case of rape. Yesterday, there was a young woman, 19 years. She was condemned to 50 years in prison for abortion. What are the lessons? Serious problems to gather information, and I want to make it specific, the gender-based violence, because there are a lot of indication for indicators, multiple indicators and sources, deaggregation problems, difficulty to cross with economic variable. And I want to end that it is important to propose firmly the needs to overcome the effects of structural inequalities. The focus is clear and the gaps are clear, the most vulnerable and backward groups. We need to reinforce the health systems and primary care. Is nothing new. This is one of the learnings from the pandemic. In these open cases, shows that decisions made are contrary to the exercise of law, and that the impacts for these structural inequalities are really beyond our limits, including sexual violence. So the point is not that sometimes we do not understand which is the link between vulnerating development rights and development, and that this is isolated, that syphilis is a problem of quality of care or abortion. The point is that we have not been able to connect the agenda components of population and demographic issues, fertility and other reproductive health indicator. This places some time for more demographic concern, that it will be impossible to achieve SDGs concerning reproductive health or the Montevideo Consensus, that this is not only a matter of democracy relating to the type of the society we want to live in. The problem is that the effects over time and cascade of impact are not assumed, generating vulneration to one dimension of reproductive health of one groups over the others. We do not measure, okay, well, the idea is life of specific real people, and we hope that the time will be reflected in statistic. So this too much time is elapsed if we are waiting for people to be condemned to 50 years in prisons when they are 19 years old. We're falling in darkness. So it's critical and controversial and point, and it is never the time, but in turn, it's always the time, because the exercise of right is not a verbal time. It's today when women, girls and adolescents put at risk their dignity, and they pay with their lives and with their freedom. They should be taken care today in the present time. Thank you, very much, Ana Cristina, for your excellent presentation, stressing the terrible inequalities and impacts on women generated by the pandemics on women. Unfortunately, statistics arrive late, so it is urgent to make decisions so the effects of pandemics on access to sexual and reproductive rights or the lack of thereof stops.
Our technical staff tell us that the problems of connection we cannot fix. So we have to apologize, but we think it will be better to make the presentation another time, because it is difficult to can hear you. So thank you very much, but we have to apologize. We will continue with the panel. Okay.
Hello. Hello.
Hello.
Yes,
well,
yes.
We can try another time.
Are you out of time?
We can hear. We can prove.
Shall I go ahead?
Yes.
Okay. Thank you very much. Sorry about the problems with the presentation. So just wanted to share with you screen. Oh no. Right. So my presentation is now up. I can't. So we'll just go ahead with the chat. So today I wanted to talk to you about what's happening with COVID in the Caribbean. Screen sharing has stopped. Can you see my screen and hear me?
Yes, we can see it.
Okay, thank you.
It's not a presentation mode.
I know, but I can't.
Okay, okay, it's good.
Yes, so we're talking in the Caribbean. Share a little bit about what and where is the Caribbean, the demographic patterns, the policies, and what happens in the future. So the Caribbean has multiple groupings and is a very diverse region. It has the groupings of CARICOM, the Caribbean Community, 15 members. CARICOM also has 5 associate members, some overseas territories. There are American overseas territories, Puerto Rico and U.S. Virgin Islands, French territories, Spanish-speaking, especially Cuba and Dominican Republic, and Dutch-speaking as well. So many countries in the Caribbean region. Populations vary from 10 million in Cuba, Haiti, and Dominican Republic to 5,000 in Montserrat. We have income groupings. Half of the countries are high income. Bermuda has an income of $80,000. Half of the countries are upper middle income. And we have one low income. Multiple language, multiple ethnicities, and the epidemiological complete. Even in Haiti, the leading causes of death are heart attack. Small island developing states of vulnerability, highly vulnerable to climate change and natural hazards, economically vulnerable, high reliance on tourism industries, nutritionally vulnerable. So although a lot of them have enough money to buy the food they need, quality of the food is determined by the imports. And there's a lot of unhealthy food being imported, resulting in high rates of obesity, heart attack, stroke, and also small population. So we have unstable numbers. So for example, population projections are done for countries less than 90% population. 8 Caribbean countries low population rate. Lots of inequalities, histories of slavery, indentured labor, and colonialism. COVID has made work, increase in unemployment. The high income people relatively well, low income not so well, and an increase in income disparity. Demographic patterns before COVID. The Caribbean has every variety of the population pyramid because we are population. So this is Belize, the classic wide waist triangle. Suriname starts to narrow there. Cuba, you see the bulge that happened after the revolution and the shrinkage before the revolution, and then reducing populations going forward. Guadeloupe and Martinique are very interesting. As you know, they are French territory. And so we see the impact where we think the rise in populations is healthy, elderly French persons from France going to Guadeloupe. And the shrinkage in the middle is the working age population going to France. That's our theory. Aging in the Caribbean is very varied. There are some areas like US Virgin Islands and Guadeloupe where this may be being driven by retirement, and some countries where there's very low. The demographic transition is advancing throughout the region. You will notice that there is replacement fertility at most countries. We are below replacement in some countries, Cuba, Barbados, and others, and there are a few countries that have high fertility. Impact of COVID, births fell, but we expect to recover, but the validated Caribbean data. In terms of mortality, that was discussed before in the previous presentation, so I will not repeat that. And the loss of life expectancy, about 2 years globally, no data for the Caribbean. In terms of mortality, morbidity, the Caribbean, for COVID, our rates from chronic diseases highest in the region of the Americas. 40% of them occur prematurely. Hypertension is a leading risk factor for death, and diabetes prevalence is double the global rates. It's being driven by unhealthy diet. Following slides, I thank Dr. Henry for these slides. Talk about the causes of mortality in the Caribbean, 69% non-communicable diseases. In terms of the risk of premature death, the Caribbean is at the top of that, as you can see in the red boxes. We die earlier than everybody else. The leading causes of death, number one is violence, followed by and is diabetes and stroke. And over time, the pattern has not changed. Some fluctuation, but basically non-communicable disease, heart attack, stroke, diabetes. In terms of this, all before the pattern, so just to show you the place that we're coming from. In terms of hypertension, factor for death, the prevalence awareness are terrible. Both males and females awareness is around 50%. No, prevalence is around 30%. Awareness, women maybe 2/3, men are high. Treatment, much less of control among men, and Jamaica falls. % of men in Jamaica have their hypertension controlled to target. 8 out of 100. Again, fasting blood sugar, the Caribbean is leading the pack. In terms of overweight and obesity, it's contradictory that the Caribbean is the top, but the reason for that is that the males in the Caribbean rates are low. You can see the right is quite high. Same thing with adolescents. The causes of this, according to FAO, 1/3 of food for the region is energy dense, high in fat, sugar, and sodium. And this accounts for the leading risk, 8 out of 10 Caribbean deaths. And you can see the link in both the Caribbean and Pacific between high import and obesity. And during COVID, we had some tourist countries had initial glut of food as the tourist industry closed down. Domestic production did continue, but there was increased unemployment, increased poverty, and therefore increased purchase of, and of course, some food companies opportunity to donate their products and to promote themselves during. We have ultra processed foods coming in from major food companies all over, makes up a big proportion of our diet. Of course, fast food, caterers to the world, Subway, McDonald's, KFC, all of them are in the Caribbean. Have our local fast food market to the children as well. A company called Chefette in Barbados. They give the children in all the schools, and the book covers are and there's a fried chicken to look at all day. We did a study on impact of COVID on household security in 8 countries in the region. This was done in July, fairly early. We found that mean fell by 26%, 62% used up savings, 10% sought help. But interestingly, there was a relationship between the need for support and the receipt of, so that a lot of people who formal sector couldn't get money from and that 40% hunger, 15% that's not good. Quickly to tell you about our Caribbean response for COVID, working with the Pacific Islands at regulations for small island states, tax, sugar, marketing, breast milk substitutes, and so on. And the Healthy Caribbean promoting Bermuda tax sugar at 75%. Since COVID, in the countries of the region have talked about reducing food imports. But the task force is looking at poultry, meat, corn, and so on. And in fact, this is imports of foods high in salt, sugar, and fat, health retarding foods imported unchecked to meet consumer demand. So this, trying to be self-sufficient is not helping with the quality of the food that we are eating. And finally, to congratulate Prime Minister Mayor Amor Macron of Barbados, who perhaps in response to COVID, but certainly COVID epidemics, increased the sugar beverage tax in Barbados 10% where 2015, and now it is now 20%. She has had tremendous pushback from industry, but she has stood her ground, and the tax on sugar sweetened beverages is at 20%, which we hope will help, which we know will reduce consumption, and that will improving the energy of the Caribbean population going forward, since it has been affected by the COVID-19. Thank you for your patience. And
thank you very much, Alafia, for your presentation, la presentación sobre el impacto.
This presentation on the socio-demographic impact of the COVID-19 pandemic in the Caribbean, talking about the pandemic in the Caribbean and health, prevalences, chronic disease, and the issue with food.
Pedimos disculpas
We apologize to those following the translation into Spanish, because since there was an interrupted audio, it was not possible to translate into Spanish. Now, we will continue with the next presentation on the most significant variable, which is the impact of the pandemic on migration. We know that many countries closed their borders in order to stop the spread of the virus. But this did not mean that migration disappeared. It continued, and sometimes via informal channels. And these migrants sometimes are employed in more informal sectors, and so were greatly affected from the viewpoint of their access to employment, economic conditions, and the aid countries could provide if they were not in a legal situation, and especially access to health. And so, to speak about this, I will now introduce my colleague Marcela Cerruti, researcher at the National Council for Scientific and Technological Research, CONICET, Argentina, and the Center for Population Studies, CENEVO, Argentina. She will speak to us on the impact on migration and population distribution. Thank you, Enrique. I would like to begin by thanking the Director of CELADE, Simone Cettini, for the invitation to be part of this panel. I think it is obvious by now that to speak of what affected the life on Earth was the arrival of COVID, with immediate consequences on health, the economy, social reproduction, daily life, with a major gender bias, as we have said since this conference began, and with a major impact on the most vulnerable populations, and which increases the gap and inequality that we already had on the continent. There were unforeseeable side effects, as Marcia mentioned a moment ago, and others in the area of work and the economy. But one of the, as Enrique just said, that was felt early and hard had to do with the mobility patterns of the population. In the next few minutes, I would like to refer to the scenario prior to the pandemic, because I believe that this is the starting point to see what happened later on. What happened during the pandemic and after in terms of the restrictions to mobility, and how were the migratory cycles affected? What situations were aggravated by the pandemic? Situations already delicate with regard to migrants. And I would like to make a specific note on the contribution made totally invisible by migrants during the pandemic, and end with, well, what to expect in future. We're going to do a little futurology, which are the pending subjects, and even more briefly than that, refer to the patterns of internal mobility, basically more in the area of hypotheses and conjectures. Now, the migratory scenario prior to the pandemic was characterized by something that occurred in the 2, 3, 4 years before the pandemic, which had to do with mass migratory movements coming from Venezuela, and with a figure estimated according to the intercoordination platform among several international agencies that since to March 2020 estimates this at just over 4 million people. But the thing is, how did this affect migration patterns? Countries that for decades had been emigration countries, such as Colombia, Peru, Ecuador, and to a lesser extent Brazil, suddenly became immigration countries. And during the time, there was a rise in regular migrants and expressions, not only Central American, because this is a suite of nations that attempt to enter the USA. And several of the hottest borders in the world are in our region. They were increasing. Migrants in transit, which we know are highly vulnerable and had to face expulsions at the border. And there had also been an increased Asian migration to South America. But at the same time, we also saw a diversification of flows, mixed flows, migrations on account of studies that had grown quite a lot within the Latin American region, sort of qualified migration, in addition to these other traditional flows. For example, Bolivian people to Argentina, Paraguayans to Argentina, and so on. The closure of borders and restrictions to mobility was the first measure adopted as a mechanism to control the spread of the disease. And in many countries, there were internal barriers, not only external ones. Now, according to a report by the IOM, there were 108,000 travel restrictions in the first few months of the pandemic. That flights had, in the first few months of the pandemic, came down by 80%, imagine. And that, as Enrique was just saying, it's not that people stopped migrating totally, but we did see a significant reduction, estimated at about 2 million people less migrated during the pandemic than what we would have seen if there had been no pandemic. And so, in terms of migration cycle, the outgoing flows were cut off, at least for a time, and populations in a situation of danger or instability that was unable to leave, in populations in transit, extremely vulnerable at different borders, and incoming migration came down. And we saw returns, repatriation, or persons, foreigners in other countries. And there was a series of movements that had to make or rather states had to make efforts in order to produce them. The situations aggravated our unaccompanied child migration, which was resumed in Central America and continues to be a serious issue, the criminalization of undocumented migrants, and which increased not only in this region, but in others around the world, not even to speak of the Eastern migrants, racism, xenophobia, increased vulnerability of migrants because the percentage of irregular migrants continues to increase. Mixed migration is also very much present today, and the number of applicants for protection and refugee status were also on the rise. And how was the life of migrants affected? Well, without a doubt, the sectors where these people find their jobs were affected by restrictions. And so the immediate impact was the inability to have an income, and that particularly affected women in domestic service, the issue of overcrowding and the difficulties to access housing was a second aspect in the few surveys done during the COVID period. This was one of the things most named. And the possible positivity and fatality. This is something I will continue to insist on. This has to do with a lack of information. I was listening to Marcia, and I felt tremendous envy of the possibility of characterizing certain phenomena with data that, in terms of international migration, we do not have. The few studies that I've been able to consult account for a greater positivity and greater fatality given by overcrowding and limitations and access to health services. There are also qualitative studies where there was a fear to report the disease and on account of the consequences in the case of irregular migrants. And in turn, the pandemic resulted in a slowing of migration processes, and irregular migrants, which are not few, were excluded from the emergency programs, special aid, and so on. Now, vaccination came a bit late, but unequally across the continent in terms of migrants. And once again, those that arrived latest were the migrants that were irregularly in our country. Now, at the same time, this population which clearly showed its contributions to their destination societies. Clearly, in the area of health, among these are migrants directly caring for people with COVID, in caring for the elderly, where they are overrepresented in the production and processing of food, delivery services, and cleaning and maintenance. Unfortunately, once again, I will return to the issue of data, but it would be very relevant to put a figure to this and an economic value as well. Now, in terms of response to the migrant population, throughout the continent, we saw aid, emergency aid for food, lodging, shelter, and essentially with money from the international organizations and IOM, UNHCR, the Red Cross, and local governments and civil society involved in the redistribution of all this emergency aid. In turn, many governments fast-tracked the delivery of this aid, express recognition of degrees and certificates related to healthcare, and when we've been insisting on the slowness of these procedures as a rule. And well, good thing it did happen in the end, and residence permits and past due visas and special aid was given. But I insist, insufficient, because the main limitation for access to all of these initiatives, except the first, was to be in a regular situation from the migration viewpoint. Now, what happened as of 2021? I would say that the main thing is the WHO, that it was not the closure of borders, but the care and the increase in the number of people who were infected. And so this increased controls and the possibility of crossing borders was restricted. Now, yes, the use of health reasons to justify anti-migratory policies, and we're beginning to see an increase of extra-regional migration, and here we can see it, Latin Americans in Spain. The number of Latin Americans in Spain is on the rise, and also intra-regional, with major unknowns on account of the lack of information.
In terms of remittances, which is one of the key elements in this link between migration and development, what we detected was that in 2021, there was an increase of 27%, especially in countries like Mexico and Central America. The patterns looking into the future, what to expect. We have delayed migratory projects, and the pandemic delayed this, but we have a generalized increase of poverty and inequality, a drop of the GDP of 6.8 as estimated by ECLAC, and also we have the impact of economic impacts of the war in Ukraine. This is increasing the immigration expectations. There are violent situations that have increased flows in Central America, so one can expect that those pressures will continue to be there. And we have climate and environmental crisis that generated massive displacements, and this will probably happen again. We are living a migration boom, baby boom, but this is a migration boom. Actually, it's very difficult to say because immigration expectations have increased, but the conditions in which a migration takes place or not depends on other factors, amongst them what will happen in the receiving countries, what is happening with the restructuring of employment and the demand for migrant workers. There are contracts for determined periods of time, virtual work and long-distance employment grows. And truly, we see a smaller receptiveness regarding forced exile. So this is a question that remains open. Now, the pending work vis-a-vis this complex scenario, well, the first one, beyond any doubt, is the need to implement protection measures of the rights of migrant persons, independently from their migratory condition. This was agreed by the countries in the Montevideo Consensus, but also we have to do additional efforts to regularize the situation of migrants. This is a must for economic and social integration and health integration today, which was an element that we didn't take so much into account before COVID. That's the impact of irregularity in access to health. Now, the third aspect is regionally coordinated actions. This becomes obvious when international and regional flows grow. We need coordinated actions, and then the relevance of timely and reliable information. And I insist because this was a message that I brought 1 month ago to the forum on the review of the compact. The information is key in order to know the trends, also to assess the contribution of the migrant. It is key to reduce discrimination, and it is key also for something that we all give for granted, and that's the knowledge of the endings of what determines and which are the consequences of migration. And we still have a lot to do in that area. Finally, regarding internal mobility and settlement patterns, I think that here we have to distinguish two effects, specific situations and long-term effects. The specific situations have to do with teleworking, online education, those who could move to more friendly areas, especially second residences. We have domestic or internal mobility, which was restricted, and therefore, due to study or labor aspects. In the long-term effects, it's difficult to assess. There's a tendency to a demetropolization in itself. It could be a factor that contributes to this, but I think that we are far from being able to say something more conclusive with the data we have so far. The persistence of telework and online education can decrease a little the internal and international mobility, but they won't have an impact at a demographic level. I think that's all for the time being. Thank you for listening. Thank you very much, Marcela. Excellent presentation. I would like to underline the issue of information. We had a gradient regarding mortality. We have data, but it would be good to have more access to reproductive health. We don't have much information, but we have what we have. Marcela did wonders with her presentation, and then governance, decision-making on a multilateral basis. That is difficult when there are wars, when we have international crisis. I think this has been an excellent panel. I congratulate you for Marcia, Ana Cristina, Flavia, and Marcela for their excellent presentations. And now I would like to thank Celade and Pamela for allowing me to moderate this session. Thank you very much. Well, now we will open the floor for statements. First, the delegation from Uruguay. Can you hear me? Well, I want to share with you a serious problem that Uruguay is living, a serious problem that has to do, that is related with a very low birth rate. This is a risk for the country of unsustainability of the social security system. Uruguay has a drop of infertility in the last 5 years. We have 30% less births. Since 2005, we have rates underneath populational replacement, and today we are underneath 1.4 of fertility rate. So this is much below the last projections made by the National Statistics Institute for our country. And this situation means that Uruguay enters a group of countries with very low fertility, 182 from 190 and something countries in fertility rates. There's a survey carried out in Uruguay on reproductive behaviors. And this survey shows that half of the population, both men and women, have less children than they would like to have. The same survey shows which are the reasons why they have less children, and these causes are related with what happens in the education and labor environments when a woman becomes pregnant, the economic situation due to maternity and paternity, and the necessary care that will be needed. This survey shows the urgent need the country needs to promote policies where both men and women in Uruguay can use reproductive rights and have as many children as they would like to have. Besides the dropping in natality and besides not having public policies, we are facing the risk of sustainability of the social security system given the populational aging that we have. And even though we have policies that have been very efficacious and have had an excellent response related with the non-intentional pregnancy in the adolescents, and we have pregnancy rates in adolescents much below the region through policies and programs, and I must recognize and thank UNFPA for these policies. Also, I would like to thank civil society organizations that helped us incorporate subdermal implant, and this provided by public health services where 50% of the population goes, and other policies that made visible non-intentional pregnancy in adolescents. And excellent results have been attained, and that's the reason why we have the figures we have today. And we have to continue to deepen in this area, especially pregnancies under 15 years of age, due many times to violence. But we can't leave aside the situation of women that would like to have more children, but they don't have them due to the conditions in our country. And very urgently, we need actions and policies that will allow maternity and paternity in Uruguay. When you think about this problem that we make visible of low natality, we think about two things. The first one is related with policies allowing maternity and paternity in Uruguay. But the second is that since less are born, we have to take good care of them. We have to take good care of our children and our adolescents as treasures. And here I would like to speak about another aspect where we are fighting for the first place, and that is suicide figures. We have a historical peak in the country above 2002 figures. It increased 45% in adolescents between 15 and 19 years of age. Suicide that became the first cause of death in adolescents and young persons in our country. 10 years ago, our adolescents and young persons died due to traffic accidents, and suicides and homicides were much below. Today, the first cause of death is suicides, followed by homicides, and accidents are lagging far behind. We have to promote policies that think about the mental health of our adolescents. The last student mental health survey that we did in 2019 before the pandemic showed that half of our adolescents, and I'm speaking between 13 and 17 years, feel lonely. There's 1/3 of them that have felt so sad and so hopeless that they have not been able to continue with the usual activities. And 1 out of 5 have seriously thought about suicide. I'm speaking about adolescents between 13 and 17 years of age in Uruguay, 1 out of 5. And that figure in the previous survey was 1 out of 10. But in a couple of years, this mental health of adolescents has become a problem that Uruguay has to face, because if there are less births and the others are dying, 80% of deaths in the youth, in the causes of death are avoidable: suicides, homicides, and others. The same survey showed that the youth believe that their parents are not aware of their concerns. We have adolescents that with 12, 17 years of age are abusing of drugs. 1 out of 4 adolescents in Uruguay have problems due to alcohol consumption, problem with the family's legal problems. We had 60% cannabis consumption for 16-year-olds in Uruguay. And the same survey shows that when the families are involved, the abuse of drugs is 6 times less. Beyond any doubt, we have to think about policies, family policies, because we need adults that have the tools in order to accompany, in order to guide, in order to show love to their children. We work in a program which is called Strong Families, and the adults tell us, I never received love, and I do not know how to express love to my child. We need adults capable of guiding, accompanying the development of our children and adolescents. We need to provide tools, because they're co-responsible with us regarding the rights of our adolescent children in Uruguay. We need adults capable of helping us so that the number of children and adolescents do not continue to drop. We need strong families in Uruguay. Reemplazo.
Yeah.
We thank the intervention of the delegation of Uruguay, and now we give the floor to the delegation of Cuba. Thank you, Mr. President, Mr. Chair. Very interesting, everything that has been said here from the colleague of the Caribbean. Unfortunately, we couldn't listen to her very well, what she said about my country. Ana Cristina on fertility, Marcela on migration. I'm not going to repeat or rebuild I'm going to show the demographic reality of my country, because there is a natural decrease in there's 44 years that we are under the replacement rate. We need to see this in the context between development, benefit to women, to families, and we have exchanged a lot with the fund and with the CELADE. We have presented this situation recently, last month. The regional director of the UNFPA was present, and our director or country director were visiting the country, and we have some exchanges about that. And obviously, pandemics did create a totally different situation, and trends broke or were halted. For instance, we are calculating. And as Simone said, I am sure that we have a decrease, a downturn in life expectancy, which was almost 79 years. But now we have an over-mortality in senior or older persons, impressive mortality. This was described the downturn, a decrease, a notable decrease in fertility. That was a trend already. In the case of international migration, we have specific. The new country here has the facility or invitation to migrate to everybody. 60 years ago, Cubans arrived to United States, to any territory of the United States, due politics, they can migrate without any problem. Residents and he can become a citizen of the United States. The law is called the Act of Cuban Adjustment from '66. That was issued by a president you don't even remember, President Johnson. So these are very peculiar, specific characteristic. And we have, yes, lockdown, and we are at what is interesting and important. I think that is that the diagnosis, we conserved our statistic, because without information we will not be able to study this phenomena in order to know what to do. How are we going to project, and if you have a stable floor of demographic social policies in favor of the population, you can recover. And that is the case in my country. In the first month, there is a decrease in the number of deaths and a small recovery in the birth rate. Migration started to recover as it stopped, and now it is increasing. But what to do? What should we do? How to see this in the possibilities provided by the environment, and how we can learn from each other? Because really, we should not wait. We should not expect too much. We should not wait until inequalities increase. That vulnerable group will suffer greater imbalances. My country has decided during the lockdown period to reinforce all the institutions, the legal protection to the most vulnerable, and work this not to approach this as a problem, but as a challenge that we need to win. And with that, I conclude. Cuba has a governmental commission for demographic dynamic led by the Prime Minister of the country. So you can see how important this commission, the significant in my country, where there is an estimate made by population division. We are now 11.5 million. The population division of the United Nations to the year 2100, we will be 7 million in the future. I won't be alive at that time to see whether this is true or no, but it shows and there's an idea of the demographic trend. We have 22% of population over 60 years, and then we will a third. How a country with a third of its population, which is over 60 years, we need to learn from Europe, what Europe has done. It nurtures and teaches us what Europe has said, but the possibilities are different. We cannot do the same that Europe did. And all of us, maybe next year when we will be celebrating the 10th anniversary of the consensus, in some parallel event, we will be able to discuss these topics as in the panel of this afternoon, and we can learn from each other. We have things to show, and we have things that we need to receive. And that is the advantage to meet face-to-face and to have this type of panels with a moderator that has made the adequate comment and the speakers that have presented and thought about these topics. These are my thoughts. Maybe the afternoon I will share other thoughts of the effects of the implementation of a consensus, but we should not, we should use this opportunity. Thank you very much. We thank the intervention of the Delegation of Cuba, and now we give the floor to Argentina, and then we will go to the lunch break.
Firstly, I wanted to congratulate
la plataforma de datos en el seguimiento del consenso de Montevideo, que es muy importante para todos los gobiernos para construir mejor.
Montevideo, which is very important for all governments to build public policies. We believe that the drop of the birth rate shouldn't be seen as a problem by states. It should be seen as an opportunity to generate greater or better conditions for choice of persons on motherhood. It's an opportunity for states to strengthen policies of care, policies of access to rights for the population. Today, for me, it is a juncture to choose between deepening my political career or being a mother. So for the Argentinian government, that of sexual and reproductive rights was something key. They have been declared as essential services during the pandemic so as to have access to contraception. At the end of 2020, we have achieved legal, safe, and free abortion after a strong struggle of the feminist group for decades now. And so we would like to express our concern for the court in Roe versus Wade retrocession. It has already an impact on our territories because anti-rights or those sectors opposing the rights of women feel encouraged to say that our rights are not legitimate. And this is a major concern. We want to repudiate that decision of the court.
Y también expresar preocupación
and express concern for judiciary actions because the conservative sectors are taking in our region these judiciary branches as a tool for moving backwards, and this should be a concern of civil society and of states as well. And I want to conclude by saying, without legal abortion, there's no equality. Without legal abortion, there's no autonomy and there's no democracy. Thank you.
Muchas gracias por la.
Thank you for the intervention of the Delegation of Argentina. We'll hear one last intervention from Peru. Thank you, Chair. I'll be very brief. It is merely to congratulate you and to say what Ana Cristina presents as unequal impacts. The information that we have worked on has to be explained. In migration, I said that in Peru, we have 1,400,000 Venezuelans, and this is not sufficiently worked or considered in indicators, and it is key for us. Being one of these studies shown one of the most affected countries globally in COVID or mortality rate in COVID-19. It is something very complicated in our country, and we need greater support from ECLAC and from the different study departments so that we can have greater depth of studies, and this is a special request as a government. 2 points now. In small studies on suicide, in Peru, suicides are linked to LGBTQ, and we are concerned because suicides are the result of bullying to gay and lesbian girls. This needs to be taken into account in specific studies. And in the case of migrations, we have a migrant population, and they earn below the minimum salary in Peru. They live in informal economy, so studies are required on that as well. It's not only the migration regulation certificate, it's also, there is something there on labor and the impact that it has on informal economy with salaries below the minimum. The Peruvian state, the government, has given a favorable opinion insofar as the depenalization of abortion in cases of rape. Thank you.
Agradecemos la intervención de la delegación del Perú.
Thank you. And now we, Venezuela.
Thank you. I thought that you were leaving me for after the lunch break. And first, thank you for Today, we have been witness again figures of Venezuelan migrants in the region, again, using platforms that they didn't mention the complete, it's the platform for, it's a fact that affects and impacts in many different countries in the region and in the world. And we go again to the case of figures, where another day they say 1.2 million, today is 1.4 million. But it depends on the figure, but the figure should be a figure. It's one single. It need not depend on who says the figure. So speaking about the consequences, it's inescapable, but causes a systemic process that in the region that affects migration for everybody. This is why it had to be dealt with in a comprehensive manner. This is our view, and this is why the support with the experience of ECLAC, CELADE, and the UNFPA in coordination with our country of preparing a comprehensive survey of the pernicious measures and how collateral measures impact in migration, not only Venezuela that are subject to sanctions. 50 million inhabitants. It's over 100 million that directly or indirectly are impacted negatively with this nation. Assuming, for instance, the Petrocaribe impact. Our position, and we already said that the previous day, to see migration as a business, we really reject that. So when it is inescapable, it's a fact that anyway we look for this support to demand the raising of criminal coercive sanctions that have an impact on vulnerable population, in this case, migrant population. Sample. We have two more presentations. We will continue with this presentation before the lunch break. Now the word to El Salvador. No. The microphone is off. Thank you. Good morning. Good morning to all of you. It's a pleasure to be able to address you as a representative and delegate of El Salvador and of the Ministry of Health. We have listened very interesting presentations of the speakers, and we feel very much identified with many of the actions that have been presented here, and also those that have experienced other countries. And what we want to share is the actions that we have been able to carry out as a country that have allowed us that throughout the pandemic, we were able to provide the necessary care to the population with special stress on vulnerable populations. Especially we started with the at-risk population, the older person, those with transmissible, chronic non-transmissible diseases. So that in all the national territory, we decided to build a hospital for exclusive care of patients that COVID patients. And with that, we made available 1,000 beds specifically for COVID patients in order to live in other hospitals, the care of other diseases, and transfer mechanism that will allow patients to be transported from one department to the other so they are not in touch with other patients, non-COVID patients, to avoid contagion. Then during the pandemic, we put in place different digital strategies for healthcare using virtual platform. I need to stress that we started or set up different telecenters for call from patients that were experiencing symptoms of the disease, and also to continue to serve the population with other type of healthcare need, children care, family planning, and that also was a space that allowed even to schedule doctor's appointments and not to lose opportunities to tend to this population. Also, house delivery of food, of drugs, so we could deliver drugs to any patient in any part of the country, especially those who needed repetitive prescriptions, or patients with HIV or other type of diseases. And also what I mentioned about the impact of COVID, we we implemented rehabilitation, physical rehabilitation for COVID patients. Finally, and also in specific population care, I want to stress about service to make migrant. In this case, migration never stop. We received people deported from other countries are all Salvadorians, giving them complete health care so they can continue when receiving and or the establishment of what we call protection status for children and adolescents that's so required. In the future, we think that digital transformation and development that has allowed us to in the middle of negative situation provided an opportunity, and we will continue in the short term to have a complete linkage of all healthcare centers and all health care establishment in order to make much more effective the service to all of our people, and also to be able to provide a health care very efficiently and rapidly. It has been a pleasure to participate with you this morning, and I wish you the best of success. Thank you very much. Finally, the word to representation of UNFPA. Thank you, Mr. President. We want to congratulate the excellent presentation of the technical panel, and also I will add my congratulations to another presentation, technical presentation by the delegate of Cuba, Alfonso, that illustrate us the demographic dynamics. Also, I want to express that the UNFPA is listening attentively with a lot of interest the presentations of the different delegations and words about low birth rate and very low birth rate, and that we are developing a technical assistance package to make them available to the country as soon as possible. And we thank the interventions of all the delegations, and we are going to the lunch break to be here back at 2:30.
Bueno, buenas tardes, señores.
Good afternoon, ladies and gentlemen, representative of the delegations. This next panel on the implementation of the effects of the pandemic on the implementation of the Montevideo Consensus on Population and Development in the 2030 Agenda for Sustainable Development and Future Action. The first presentation will be moderated by Lucy Garrido from Marcosur. Ladies and gentlemen, delegates, he is clarifying because in the Spanish version he referred to the delegates. Before anything, I wanted to thank you. I think that it is an opportunity that we civil society organizations have, and that is good to take it, and it is good to be part of these panels and, well, reason and move ahead as we try to do it throughout the region, with the spirit of the region. The focus of this panel is the actions taken to mitigate the impact of the pandemic on the implementation of the Montevideo Consensus, who are subjects of rights according to the Montevideo. We're clear that we must clarify it in the region, and the governments should be even clearer. Second thing is how to ensure social protection and the enjoyment of rights and gender equality. And third, how to maintain the Montevideo Consensus implementation and also of the 2030 Agenda. And so for this, I would like to quote a little bit of a text of the central document of SLADE for this conference, and that says that rights and equality are the main pillars of the Montevideo Consensus and are central to the development model proposed by ECLAC. And that then differentiated enjoyment of these rights is the greatest expression of social inequality in our territory. So I would like it if, when the members of the panel answer these questions, they may see it from that viewpoint. And to clarify it, there will be some of the people who have been invited to take part will do so over the internet by video, and none of the persons here are a hologram, but rather we are here in person. And it is good, this modality that we have adopted, and this may be each time more usual. And so to begin, we will recognize the first speaker, Minister for Women Affairs and Vulnerable Populations of Peru, Mrs. Diana Miloslavich Tupac. My dear members of the panel and the chair of the conference, Lucy Garrido, from the Feminist Articulation Mercosur, Gabriel Rodriguez, Mexico Secretary General of the National Population Council, CONAPO, Patricia Muñoz, the Childhood Ombudsman in Chile, Maria Carmelina Londoño, Vice Minister of Multilateral Affairs, Colombia, Joaquin Henry, Minister for Social Equity, Justice and Empowerment, St. Lucia, Mirna Cunningham, Nicaragua, First Vice President of the Fund for the Development of the Indigenous Peoples in Latin America and the Caribbean, delegates from ECLAC member states and associate members, ladies and gentlemen, and representatives of the civil society. Our region, as many of us know, is the most unequal region in the world, an inequality that has become more evident with the pandemic originated by COVID-19, in which the most affected are the most vulnerable groups, such as children, adolescents, and young people, the elderly, women, migrants, indigenous peoples, Afro-descendant populations, and people with disabilities. and the LGBTIQ community. Peru, which has had a commission for the sincerity of its mortality figures, is among the most affected at world level, which has marked its recovery. On gender equality, the pandemic has generated differentiated impacts on women and has meant a setback in gender equality. During confinement, there was a greater exposure to the risk of violence due to confinement, and at the same time, there were difficulties in accessing anti-violence services, as well as sexual and reproductive health services, and the provision of contraceptive methods. In addition, we've seen setbacks in the economic autonomy of women. In the case of Peru, a setback of more than 10 points in their participation in the labor market. On gender violence, our services reacted quickly to adapt their interventions. In 2020, we had 409 women's emergency centers throughout the country with more than 4,000 public servants. The Peruvian state decreed mandatory confinement on March the 16th, 2020, and culminated its most rigid stage on June the 26th, 2020. The Aurora National Program adopted exceptional measures to guarantee the continuity of services in order to provide timely attention to acts of violence against women. In March 2020, it issued an internal regulation that recognized as essential services for the attention of violence against women and family members the temporary shelter homes, 22 in the country, the 100 line and the 100 chat line, the emergency attention service present in 8 regions of the country, and the recently created itinerant emergency teams. On the itinerant emergency teams, in March 2020, the CEM stopped providing face-to-face assistance and developed the itinerant emergency teams as an alternative. A total of 959 itinerant teams were formed, multidisciplinary teams from the women's emergency centers made up of psychologists, lawyers, social workers who travel to the victim's location, with presence in all provinces of the country and to 24-hour service capacity. The proper functioning of these teams depended on adequate coordination with other agencies in the territory, such as prosecutors' offices, courts, national police, or offices of the Ombudsman's office, which referred cases to the teams. Likewise, these were channeled through the Line 100 and the Chat Line 100. As of December 2020, the women's emergency centers began to reopen so that throughout 2021, they operated in a mixed manner, and the itinerant teams, depending on the levels of confinement, curfew, or prevalence of illness in the teams. It was necessary to have almost a case-by-case strategy. By 2022, our 430 CEMs, new ones have been opened over the years, provide almost 100% of face-to-face care. The Line 100, during the mandatory quarantine, our support hotline, Line 100, doubled its demand, operating 24 hours a day. During confinement in May 2020, 23,000 calls were received, when in May 2019, the figure was 9,800, and in July reached 26,800 calls. This meant increasing the staff to 273 professionals, 53 new operators, and included 8 Quechua-speaking operators so that indigenous women could be attended in their mother tongue. On economic autonomy, as we commented, the economic impacts in terms of unemployment and women's exit from the labor market have aggravated their already unequal situation in an informal economy such as the Peruvian one. This was aggravated by the increase in unpaid domestic and care work in households due to the new hygiene protocols, increased household members, and accompaniment in virtual classes for their children. Faced with the need to address the sexual division as a central element of inequality, we have initiated the way to establish a national care system, which was already outlined in our 2019 gender equality policy. We started in 2021 with the establishment of the conceptual framework on caregiving, which has been followed by a consultation with the 7,000 care receivers and caregivers of women, adolescents, older adults, persons with disabilities, and other caregivers. At present, the bill for the recognition of the right to care and the creation of the national care system has been finalized and is currently before the executive branch for passage to the legislative branch. And during this period, there were also 2 surveys on time use over the last 2 years.
El 2020 se aprobó.
Physical autonomy. By 2020, the normative document was approved and implemented to guarantee the health of pregnant women and the continuity of family planning care in the face of the COVID-19 infection with Ministerial Resolution 217/2020. Then, the care of adolescents was adopted, prioritizing the provision of contraceptive methods. In addition, in 2021, it is updated with a health directive for sexual and reproductive health care during the COVID-19 pandemic. By the year 2020, the cumulative figure from January to December was 844,587 couples protected with contraceptive methods. And by the year 2021, 1 million couples protected, thus recovering the significant drop in the use of modern contraceptive methods during the first year of the pandemic. The figures also show a decrease in teenage pregnancy according to the data reported by ENDES. Teenage pregnancy in 2020 reported 8.3%, being the lowest figure recorded since this indicator has been evaluated. For 2021, it is at 8.9%. However, despite this increase of 0.6%, it can be observed that the trend is downwards. However, we're also facing atypical years. Political autonomy in 2020, after years of hard work by the Ministry of Women, the civil society campaign Somos la Mitad, Queremos Paridad, and various allied spaces guaranteed that women make up 50% of the list of candidates for popularly elected positions. With great satisfaction, we can say that this law had its first application in the general elections of 2021 during the pandemic. The result was the representation of women in Congress, which is greater than in previous periods, with 50 women, parliamentary women representing 38.5% of the legislative policy. Regarding political harassment, we have Law 3155 that prevents and punishes harassment against women in political life, which granted our ministry competences to supervise political organization in matters of harassment. On the other hand, 7 years ago, this sector institutionalized the working table to promote and guarantee women's political participation. This is a space that allows us to maintain an articulated dialogue with civil society organizations, institutions of the national electoral system, and the Ombudsman Office. From this space, we have carried out the bicentennial meetings of women mayors, providing technical assistance to improve the management of the 107 provincial and district women mayors, monitoring of cases of political harassment against women in political life, and schools for women candidates. And also, we are supporting the training of women authorities. Children and adolescents. In Peru, educational services were closed for 2 years, so that children and adolescents saw their school classes interrupted, the consequences of which will be seen in the long term. And new policies are being sought to reverse this problem. According to the Lancet, by June 2021, Peru was the country with the highest number of children and adolescents who had lost a parent as a result of COVID-19. Financial assistance. In 2021, emergency decree an emergency decree was enacted, which grants economic assistance to children under 18 of age who have lost a father, mother, or both due to COVID-19. In November 2021, a new regulation was approved in order to ensure the continuity of economic assistance for orphaned children and adolescents, and also, and this was additionally to their access to health, access and continuity of education and their life project. Today, we have already started a pilot program to accompany children and caregivers in 2 places in Cajamarca and San Juan del Urigancho. In December 2021, when we approved the last list of beneficiaries, we reached 19,000 children and adolescents with an orphan's pension called economic assistance. This year, we must start the implementation of the universal economic assistance for orphans, which includes orfandad por COVID-19, and we must approve another list for next August. To this end, we plan to create a national program with its own decentralized administrative and budgetary management, going beyond a platform of monetary transfers, guaranteeing access to services and thus guaranteeing rights, and which can also disseminate and follow up on our children and adolescents who have been impacted by COVID-19. Regarding the care of children and adolescents without parental care or at risk of losing them, the Special Protection Unit attended a total of 26,945 cases of children and adolescents. In the period between January and May, we have attended 11,357 cases, which represent 42% of the final figure for the year 2021, and an average of 75 cases per day. I mention these cases because this is the impact not only of the pandemic, but also of the food crisis and the poverty crisis. So this is the reason why we have to take care of 75 cases per day at a national level. We are working hard to develop better processes and provide special protection units with tools and resources. As a priority of the Peruvian government, one of its priorities is to protect the rights of children and adolescents without parental care or at risk of losing it. In April, we created a working group to evaluate and recommend the necessary measures for this service to effectively and efficiently face its responsibilities so that it can carry out the work that we have to do. Regarding elderly people, the elderly population was more affected due to the risks to their health. As a preventive action, permanent monitoring of public and private residential centers was increased. We approved the strategy of centers for the elderly with the purpose of articulating actions with the different entities, public entities in favor of the special care group and residents of care centers for the elderly, CEAPAM. We provide differentiated and priority care before the COVID-19. In that year, the strategy reached 315 CEAPAMs nationwide, reaching 6,627 elderly people, but we believe this is not enough. We have also approved the national policy for the Afro-descendant peoples, pending challenges. Initially, the CEMS, that is the Services Against Violence, were closed, then declared essential frontline services for care against violence against women. We believe it's fundamental that health and education services, as well as services that relate with women, the elderly, have to be declared essential, fundamental, a priority in our states. Also, new strategies and itinerant services against violence, as well as the use of telephone follow-up that can facilitate care for women, and this should be incorporated into the post-pandemic. The absence of operators in native languages, so we incorporated the Aymara language and we have other Amazonian languages, and that continues to be a challenge for a country that has recognized that 26% of its population corresponds to an indigenous and Amazonian population. The closure of care and educational services had a special impact, especially on women caregivers. So we need specific measures to avoid deepening poverty conditions, especially in single-parent households headed by women. The system that I have mentioned, we hope that we will be able to implement it in the coming months. The impact of the pandemic on children and adolescents who have lost one of their caregivers requires psychosocial and educational support, which must be addressed and should also become a priority. Regarding the health emergency, we detected problems in the distribution of emergency kits for rape victims on behalf of the health service, and intersectoral measures had to be taken to reverse the situation. However, we must continue working so that this delivery is timely in any crisis and emergency situation. During the pandemic, there was a greater visibility of the transgender population, as well as the visibility of the migrant population of girls and women. The challenges we face in guaranteeing the rights of populations and mitigating the impacts of the pandemic force us to think about more structural approaches. And in this context, the transition to a care society is crucial. If we were a caregiving city, things would have been different. So the territorial pilots of the national caregiving system need to articulate the different interventions, and that should be a priority, as well as fighting for the economic resources and budgetary resources for all these new challenges. Finally, going back to the panels we've heard today, we need to have timely information, and we need to work on the inequalities. I believe with what we have so far, it has been enough. Thank you very much. Thank you very much, Minister. It is impressive, and I would like to underline that the need for what we're showing in Peru that has happened in so many countries, but in Peru, Brazil, I believe it's a reality that is very striking. The number of orphan girls and boys, and that together with the older persons that are alone, it is so important for us to have strong states. If you think about those things, only thinking about that, it's enough to realize that we need stronger states. Now we give the floor to Patricia Munoz, the offender ombudswoman for children in Chile. You will speak online. Thank you. We now listen to you. Hello, how are you? Good afternoon. I hope you can hear me well. I would like to greet you all the persons that are present here. Especially, I would like to greet my panel comrades to speak about such an important subject as how our countries have been capable of turning the Montevideo Consensus and the 2030 agenda. It's so important that it has been possible to implement part of it to face what the pandemic has imposed. I'm online because of a presidential activity that didn't allow me to be in person, but I thank the understanding of the organizers, and I hope this presentation will be useful for the subject that we are discussing, and that certainly needs a very deep analysis of the different stakeholders that through their different public roles can make a difference
in the impact and living conditions of population in general, and especially those most vulnerable ones like girls, boys, and adolescents. Firstly, I would like to do a sort of general description of the role of children advocacy or defenders, because this is not very common in our Latin American reality. Only it exists formally in Argentina and Chile, and tell you that this human rights autonomous institution that emerged as a result of a persisting struggle of the organized civil society working for and fighting for the rights of girls, boys, and adolescents to have a body that could defend the rights of this group of population. That fight of civil society was included by the Committee of Rights of the Child that on June 29th, 4 years back, we saw the start of this institution that, with autonomy from the other branches of the state, has the duty to disseminate, promote, and protect the rights of boys, girls, and adolescents that live in our country, in accordance with the requirements or with our political constitution, but also the Convention on the Rights of the Child, which is indeed an international essential standard for their protection, considering the superior interest of children. The role in our institution is, what's most important is the autonomy in exercising its functions. It's key in order to strict compliance of the state and monitor the role of the state in defending the rights of boys, girls, and adolescents. So, how the pandemic has impacted the compliance of those agreements that were achieved and that concluded with this major initiative, which is the Montevideo Consensus. And for that, we need to highlight something that maybe it's unnecessary to say, but I believe it's always necessary to say, because we need to integrate and achieve societies to understand that boys, girls have or are subject of rights. And in view of their age and evolution, they have specific special rights derived from precisely the age and stage. And these are translated into specific duties for families, for societies, and for the state. And thus, to insist in the relevance for states to commit to actions proving every single day that boys, girls, and adolescents are a group of the population that need to have a reinforced and special protection. Let us not forget that in Montevideo Consensus, the rights of boys, girls, and adolescents are addressed, and among the 8 subjects of this consensus, you have some that are very relevant as the defenders of childhood. First, a life free of poverty and violence, protection and enforcement of human rights, availability of options, access to health, education, and social protection. As to public, then, mechanisms for effective participation, public education, comprehensive education for sexuality, and implementing programs of sexual health, avoid dropouts of adolescents or pregnant girls and young mothers, prevent pregnancy in adolescents, to have the need of generating statistical, reliable, disaggregated data in different themes. In view of that, then, we believe that this consensus reveals very clearly subjects that for boys, girls, and adolescents are key, crucial. And thus, we can tell you that in the year 2020, in view of surveys and consultation, in view of the first opinion poll that we conducted as an institution where boys, girls, and adolescents gave their ideas on their rights, we can say that the main problems for them are school bullying or harassment, 57.2%, the lack of comprehensive sex education for girls, boys, and adolescents, 35%, and violence and insecurity in the streets, 35%. Here, we have other concerns that for girls, boys, and adolescents participating in this survey are relevant. Violence in unions, in equality in education, environmental problems, violence of police, lack of opportunities to continue studying, psychological problems, not being able to participate in elections, right to vote. So, in this way, girls, boys, and adolescents not only have a very clear idea of what are the problems they're facing, but they want to participate in areas where they can have a voice and thus public action, but also society and families can integrate their needs and desires. In this study was conducted in 2019, where our country faced a social crisis situation that is called the social disruption unrest, and therefore revolt. But then after this student revolt, in the boys, girls, and adolescents highlighted as one of the most important rights to be ensured was to have better education. That is what they said, 34.1%. And the most mentioned right was the right to grow healthy and protected. And of course, this refers to these themes involved or included in the Montevideo Consensus. As Children's Ombudsman, we have prioritized the impacts of the pandemic in girls, boys, and adolescents in Chile, and thus make recommendations to the agencies of the state, and thus avoid the harmful effects of this crisis to persist in time and not to be addressed, solving needs. Firstly, I would like to refer to poverty. And we can see how between 2017 and 2020 in Chile, there has been an increase in the percentage of girls, boys, and adolescents in situation of poverty due to lower incomes. And this impacts most severely the boys and girls of early childhood, the smallest one, then the migrants that in view of humanitarian crisis lived in Venezuela has involved massive entry to our country, and also girls, boys, and adolescents of indigenous peoples that represent an important focus of lack of enforcement of the rights of this population. In line with poverty, there is an impact in terms of sanitation and overcrowding of housing. I mean, the lack of decent life, and we can see that between 2015 and 2020, there has been an increase in the percentage of households where they have deficit levels of sanitation of the house, and that has an impact, of course, in rural areas, where very often you have the separation of the state or the inability to reach out with all the public utilities enabling all these rights. In agreement with this, we have evidence based on existing data in our country, the increase of boys, girls, and adolescents living in settlements or camps And as a result of a cadastre of Techo that works with the different settlements, it was identified that for 2021, 57,384 girls, boys, and adolescents under 14 years of age were living in these shanty towns. It was evident that it was much greater than the 24,687 cases identified by the Ministry of Housing in 2019. So it is evident that the creation of these settlements or shanty settlements has increased and thus impacted the life tremendously of girls, boys, and adolescents. But also, we have observed a severe impact in health. And therefore, between 2017 and 2020, there has been an increase of children without any health coverage and a decrease of children that had medical care in the last 3 months. And that is, for example, we have a program that's called Control of Healthy Children, but we have been very much concerned because this has decreased drastically. So the state needs to reach out to these boys, girls, and adolescents, although their families cannot reach out to the public health institutions. One of the essential factors to enforce the right to health is, of course, prevention. And therefore, we are concerned about the lack of medical interventions in so far as control and care. There has been an impact on nutrition, as we observe a reduction in the number of children of nursery school of the 1st to 5th grade with normal weight. And thus, all the nutritional abnormal situation have increased, except overweight. Overweight has increased. But I would like to stop or dwell on an aspect that is particularly relevant, and I imagine in your countries call for special attention and action with an impact on the lives and impact on the mental health of boys, girls, and adolescents. There's a study that's called Impact of the Pandemic due to on mental health of Larraguibel, Rojas, Halpern, and Mont in 2021, showing the significant impact on the mental health of students since pre-kindergarten to 4th grade, all the symptoms that were assessed. And this study reports that the symptoms that have increased is the lack of wish to do activities, lack of appetite, even being more hungry or less hungry, and bad temper, disobedience, changes in appetite. And although we need to say that this study says that these symptoms baseline were high before the pandemic, but this study suggests that this evidence needs to be taken into consideration in order to have a health response vis-a-vis the pandemic. Here we are developing a study of policies on mental health in our country. Only one first question. Do you think that the pandemic and lockdowns have generated an increase of the following difficulties of mental health, and which ones? And here
the high percentage of anxiety, depression, 83%, self-injuries, 57%, suicide attempt, 52.3%. Without any doubt, they represent especially serious situations that need urgent treatment. And this is a survey that we, as the Ombudsman Office, we applied in 2021 online to teenagers. So it's evident that along these four especially important factors, how the responsibility, it is urgent for the state to intervene to really fight against this very complex aspect that can even during teenage years reduce the impact. They can have a significant impact in adolescents. Also, there is an impact in education. From 2017 to 20, there is a decrease in the percentage of children and adolescents from 0 to 13 years old who attended school. And we as a country, we already have a very complex situation in terms of social exclusion or dropout. 132,000 cases, with the forecast that in this figure can increase in 81,000 additional children and adolescents that are exclusion. I'm speaking about exclusion and not dropout, because the educational system has not been able to provide spaces in which children, because of different vital and social conditional status, can stay in the educational system. And today I am in Arica in the northern part of the country, and in the valleys of this region there are no schools open. And because of that, rurality and the remoteness, the distance from cities, this implies that the children are working with the family, and nobody can decide that this drop out. That is a conscious decision from the child or the family to not go into school. What we have is a system that does not open space for education to be a reality, and this is the responsibility of the state. Unfortunately, the impact has also impacted in violence, and then we can observe that regarding peer-to-peer violence at the school level, we can compare 2018, 2022, there's not an increase in the total violence, but there's an increase in the type of school violence. Physical and psychological abuse among students increased 38%, and complaints and denunciation related with cyberbullying increases in 148%, which shows that there is an urgent need to prevent the space of school violence that can provoke and can generate, that can give rise to irreparable consequences for bullying victims. And I also stress another spaces of violence, that is the extended closure of school and sanitary restriction that you all experience in your country. What we observe is that schools are not only the space when you go to learn to read and to write and arithmetic, where the only important thing is the academia. It's also a space where the rights are protected, where children get their food, where children have a space in which they are protected from possible social and family problems. And also they build their identity with the peers, and the possibility of participating in face-to-face classes has had an impact in child abuse, as evidenced in this presentation, especially by analyzing UNHI, which is institution in charge of kindergarten and primary education in our country. How, from this perspective, there is a notification of abuse that we need to take care of, and how that also expression around family violence, and a factor that we need to address urgently, considering the black figures, because it is impossible sometimes for victims to present the report, the the case. These are recommendations that we have given to the executive power and other bodies of the state, because it was evident that regarding the analysis that we have done, that the state during crisis situation, the answer is worst. Could be obvious, but we could expect that during crisis situation, the state could trigger better mechanism. And we recommend the Undersecretary of Children that was created in 2018 to adapt planning instruments to be able to integrate the specific needs diagnosis with the effect of the social revolt and COVID-19. We need to empower and booster the capacity of the healthcare system to interact in an efficient manner with the education and the protection by detecting situations of negative impact on the physical and mental health of children in an early manner. And this is key, considering what we have discussed, the need to coordinate and implement disaster management measures, but because we should not say, no, we will never have crisis, and act as that we will never have crisis anymore. And we need a lot of preparedness. It's essential in terms of the right to information to implement a pertinent and relevant risk communication addressed to children. It was evident that authorities communicate thinking that we do not have children or adolescents in the country, and the very technical words, they think they should be understood by the children, while children, the teenagers do not understand because they don't use clear and understandable language depending on the age group. We also recommend to reinforce the governments of the state and all their body in a context of crisis or emergency, because they didn't deal with it in the proper, in a good manner, and that the state with a focus on rights. So the budget for children and adolescents should be prioritized and not impacted in during crisis, involving creating even more complexities and problems for the children and adolescents, and the possibility that they will be living in the spaces of worst possibility for the exercises of the rights. This type of meeting are extremely relevant to stress and highlight these points. As an autonomous human rights institution, we have make efforts so that the state of Chile can accept and generate significant changes that putting the children and adolescents at the center in the condition of subject of right, and ensure the real exercise of the rights that are ensured in the Constitution and in the Convention on the Rights of Child. Thank you. Thank you, Patricia. In the ombudsperson of the children in Chile, I think this will be a reference for many other further studies, and the issue of mental health for children and adolescents. I would like also to deal with the mental health of mothers and how they are double impact. Now we're going to give the floor to Gabriela Rodriguez, General Secretary of the Population Council in Mexico. Thank you, Lucy, from Articulación Feminista of the Mercosur. I'm happy to be here with the officers of CELADE, General Director of UNFPA for the region, our colleagues from Chile and Colombia, and the priorities of the current government in Mexico. The priority of the current government in Mexico is to eradicate exclusion and expand human rights and welfare to all populations, especially those living in poverty, such as women, children, adolescents, people of sexual diversity, indigenous, Afro-descendant, and persons with disability. Actions today are framed into 38 priority program, of which 19 focus on the more vulnerable population. Hospitalitarian convention was an effort with the healthcare staff to contain the contagions among the Mexican population, and we implemented a regionalized estimate of the behavior of pandemic that we call the risk light, the prevention, this social distancing and lockdown. We try and make an effort to preserve and respect human rights, but at the same time impeding the spread of COVID. The sequence of vaccination of COVID started by vaccination of healthcare worker, the elderly over 60, teachers, then 86% of the population older than 12 years old, and then those of 18 years or more, and 54% of children and adolescents from 12 to 17 years old. The transparency, accountability were the principles driving communications during the pandemic. For 1.5 years, we held one daily press conferences informing on statistic of death, contagion, availability of beds, and specialized services to tend to COVID patients, and preventive action based on scientific evidence. Figures of the National Census of Housing and Development, whose field work ended at the start of the inception of the first wave of the pandemic, allowed us to have updated data and a robust base to assign priorities to identify the location and number of vulnerable population, to survey for the surveillance of mortality and assess the real magnitude of the pandemics. We conducted an analysis of excess mortality for all causes, which was a product of an institutional work. The outcome that in 2020, the excess mortality was 43%, of which 66% were COVID-associated death. In 2021, the percentage was 47%, 71% directly associated to COVID. Excess is the addition of death directly linked to COVID and indirect due to sanitary emergency. As of July 2022, we estimated the prevalence of the main comorbidity that are obesity, diabetes, and hypertension in deaths due to COVID in each one of the municipalities. So the most affected entities, those that in the large cities, border areas, and touristic centers. The multilateral arena, the leadership of Mexico was evidenced in the donation of vaccine to 800,000 vaccines to Paraguay, Belize, Bolivia, Honduras, El Salvador, and Guatemala. In terms of economic growth, we prioritize the regions and production sectors that were lagging behind, and pushing the reactivation plan, the reinforcement of internal market, the development of investment and international trade, regionalization of economic activity, and priority assigned to strategic sector. The minimum salary increased at 66% compared to the previous government, with a recovery of purchasing power of 151% in the border in the north and 67% in the rest of the country. In the municipality, the policy reduced in 20% the salary gap due to gender to ensure the right of education to intercultural, inclusive, comprehensive education and to avoid school dropout due to economic reasons. There was a priority investment in the coordination of scholarships to students of poor family with already a constitutional right.
Annually, more than 11 million grants are given to primary, secondary, and higher education students, and more than 1 million for students of a technical and higher education level. Economic support is given to people with disability, of indigenous groups, all indigenous group with disability from the ages of 0 to 64, and with children with disability from 0 to 29 years of age. With the pandemic, the technological strategy, Learn at Home, was widespread, a very complex system of learning at a distance using television, internet, radio, and free of charge books. To attend lessons at a distance, families made a 27% additional spending to acquire smartphones and hiring internet service, according to a survey on measuring the impact on education. Nevertheless, these major efforts with grants for education and families and caregivers, a total of 2.3 million students did not enroll in the next school cycle on account of the pandemic, which represents 10.8% of the total. In addition to the grants, another important pillar during the emergency was, without a doubt, the young people's building the future, which is a minimum wage paid for by the state so that young learners may have an opportunity to acquire knowledge, skills, and experience the first job, mainly in the private sector. The telephone survey on COVID-19 and the labor market allowed monitoring the situation of the labor force as a result of the health contingency, making decisions and following up on labor policies. The strategy, Women Export MX, was designed to accompany companies headed by women that would like to access international markets, and the free market strategy supported economic development of women entrepreneurs and Mexican business women, training them on business skills, financial inclusion, and facilitating their access to platforms for digital trade. The government of Mexico has policies, plans, and programs that ensure human rights of the adult and elderly persons, and in addition to being a priority group for vaccination during the emergency, it became very, very relevant. The universal pension for older persons over the age of 65. More than 10 million people receive this benefit, at 12% of all persons over the age of 60, and who during the pandemic received it up front to avoid the risk of contagion due to mobility. This pension, the current president committed to double it over the next few years. And according to the National Household Income and Expenditure Survey, income down by 11%, and family income 6%, and in GDP 8.5%, which allows us to say that the cash transfer programs have been an effective redistributory policy. Through transfers, income increased by 12.6%, and 56% of these are government programs, and transfers increased 12.6%, of which 56% are government programs and 20 refers to pensions. Health services were affected, although in Mexico they were considered to be essential services. Institutions made sure they continue to work. However, with the outbreaks of contagion and hospital situation, it was not possible to guarantee the continuity of these prevention measures at all health centers. Regarding universal access to sexual and reproductive health services, we realize the relevance of always foreseeing the possible occurrence of a health emergency. We must make the most of the experience learned and ensure the supplies and distribution of contraceptive methods, access and care, and giving priority to mother and child care and unborn children, as well as strengthening social communication and responsibility with regard to sexual practices. As to maternal deaths, as of 2020, services of safe abortion have been strengthened at the 32 federative units, affecting the reduction of maternal deaths. And as to the prevention of girl and adolescent pregnancies, for the first time in Mexico, progress was made in timely access to abortion, which facilitates the early and timely identification of sexual violence against girls under the age of 15 and of those who become pregnant. And friendly services were strengthened to provide a service in care of sexual and reproductive health of adolescents for more than 2,000 services in the various units in the country. Friendly services are connected to the national strategy for the prevention of adolescent pregnancy, involving 28 federal institutions and various civil society organizations. The strategy seeks to reduce by half the pregnancies among adolescents and eradicate those in girls under the age of 14. Interventions need to strengthen comprehensive education about sexuality in the school curriculum, which today is a human right, a constitutional right, and above all, emerging issues regarding sexual and reproductive rights. The right to the legal interruption of pregnancy, which today is not part of the school curriculum. Also, teachers are trained in the primary, secondary, and higher education level through a national telephone line, and also campaigns disseminated in traditional and digital means of communication with the slogan, "I decide my future and I demand respect." Campaigns contribute to the prevention of pregnancies and strengthening the autonomy of girls and women, and do away with child marriages and forced marriages, eradicating sexual violence, and ensuring access to the legal and voluntary interruption of pregnancy. In cases of rape and when the woman decides. The federal code was recognized 18 as the minimum age for marriages that cannot end from one day to another. And on account, this is a main part of a cultural aspect, highly deeply rooted in our country. This showed the inequality in the distribution of the economy and care given by women, and also a rise in family violence on account of gender. And so there was a special telephone line made available, safeguarding the situation of young people and women in shelter, transit houses, and emergency. In January 21, the protocol for interinstitutional coordination was passed for the protection of girls and adolescents victims of violence. The phenomenon of migration was also affected during the pandemic. On account of the closure of borders and the low economic activity, the flows of migrants came down, and the travel to the U.S. was slowed. We needed programs to provide integral health care for the migrant population, including those without documents, many of which are women from Central America and other regions that go through our territory. Today, efforts are focused to include the human rights and gender approach into our migration policy, and asylum, shelter refuge are strengthened in this situation. The COVID pandemic had a greater impact on indigenous and Afro-descendant communities on account of the social lag and insecurity that they live in. And emergent measures were implemented, access to health care, preventive campaigns in indigenous languages through the radio broadcasting system. And also today, recovery actions go hand in hand with recognizing the indigenous people and Afro-Mexican groups. I'm about to conclude. By the end of 2020, we will conclude our forecast for population in Mexico and federative units for the next 50 years. The prospective exercise is a major event because the impact of the pandemic caused by COVID are determinant of certain indicators, demographic indicators. We will have to identify areas of opportunity, tasks to cushion the effects of the pandemic, school attrition, the lack of health care, lack of attendance by school children, and sources of income that has mostly affected women. And we must take into account the reconfirmation of homes on account of the loss of its members. Our priority is to strengthen the capacity of the 32 state population councils, and that we have to make territorial what we do. And lastly, I thank all institutions in Mexico, both federal government and civil society organizations and academics who sent us the inputs to present this report, and most especially here to all my CELADE, UNFPA, and CLAC organizers. Thank you. Well, thank you very much, Gabriela. It's quite impressive, really. I hear what my colleagues say in her reports, and I think, well, how could they do so much? And then I think, well, but how much didn't we do? So how did all this happen? And sometimes it happens, as Bernard Shaw says, there's a drama when all characters are right. I think that states have done a lot. And also, I believe that it was insufficient. And that is something that we must work on more than anything else. What good things were done in Mexico? How good this of Peru? How good was that in other countries? And this must serve as a guideline, because this will continue to happen. And then the next pandemic, how will it catch us? Weaker or stronger? Because that will depend a lot on what happens to the populations in our countries. Now we will move on to Joaquim Henry, Minister of Equity, Social Justice and Empowerment of St. Lucia. The floor is yours.
Thank you, Madam Chair. Good afternoon, distinguished panelists. Ladies and gentlemen, also let me acknowledge the members of civil society. They're quite visible in the operations today and in the past few days, and other ministers and high officials. This afternoon, again, I want to share with you briefly the perspective of St. Lucia. Just to remind or to let you know that the new administration, the new government of St. Lucia came into power in the middle of the pandemic with an overwhelming mandate. Of course, reviewing what was happening to St. Lucians during the mandate, we came on the mantra, putting our people first. And of course, while we assumed this responsibility, the Ministry of Equity, Social Justice was the lead ministry in terms of promoting and advocating for the vulnerable population of St. Lucia. Certainly, we have endured hurricanes and we've gotten used to storms, but never before our population have been subjected to a pandemic in the nature of what we all experienced. There was a high level of uncertainty, not knowing what to do, what to expect. When homes were closed, initially we were afraid. Persons had to prepare themselves outside, get a shower before you enter your home or street, remove your clothes. Wives were afraid when the children went out. So it was really a difficult time at the initial stages of the pandemic. Food became an imperative. And of course, we saw government were not prepared to respond. And therefore, immediately when we came into power in July last year, we embarked on a number of initiatives, some of which I'll need to point out. The removal of school facilities fees. While education is free, but each school have an amount that each child pay for the maintenance of the facilities, we removed this. We provided learning devices, and this is continuing. The exercise of having laptops and tablets to all children is a mandate of this government, our government, and we have distributed thousands of learning devices to our children. We continue to provide food support, especially to our vulnerable homes. We've developed what we call food vouchers, and we've used the small grocery shops in communities to empower them so that persons also participate in supporting community grocery shops. We've established, very importantly, a youth economy agency and invest resources in this agency so that we empower young people in their micro-enterprise. So the Youth Economy Agency, we have passed legislation just before I came up here, and we're going to see the establishment of an agency responsible for investing in our young people. Of course, we have passed legislation for domestic violence, and this showed up in the experience of households during the pandemic. Domestic violence has raised its ugly head, and notwithstanding, as I've discussed with my permanent secretary, that we have passed legislation, but we need to aggressively campaign hard to make domestic violence and those who perpetrate and bring about these changes in the lives of people uncomfortable. I believe that those persons who participate in making the lives of our women and our children in particular need to be uncomfortable, and they should be no haven for them to secure themselves. Of course, people living with HIV, we have provided food for children living with HIV, but of course we have revisited our children with disability and young mothers in particular who have children with disabilities and they are unable to continue the education. We have given focus and attention to them. We have teenage young mothers who are unable to continue the education, and we have decided that we will pay close attention. The issue of data collection, while we support a lot of the interventions and align ourselves with what is happening at the level of ECLAC, and we commend ECLAC and the partners for bringing such good resource to make our work a lot easier, we continue to see persons falling within the crack, and we see quite a bit of chronic disabled children who sometimes are not captured within our data set. And therefore, we have embarked on having this mission so that we could cater for children. And in instances where we find children who are chronically disabled, in most instances, the mothers are very young and teenage young mothers, and therefore we are given some serious intervention to rescue and to provide opportunities for them. We had the opportunity, as with the support of our Prime Minister, the public assistance was just about, I think, 9 million, catering for almost, I think, 3,600 persons. Immediately, and I thank the Prime Minister for agreeing to increase it by over 100% during the pandemic so that we could cater for more persons who were on the breadline. Understanding that thousands of St. Lucians work on the cruise ship, when the pandemic hit, a number of our St. Lucian female headed household had to return to St. Lucia being unemployed. And the fact that they did not contribute to the national insurance scheme, they didn't have a source of income. Our government provided support to them. And like I said, also we have, because of the tourism environment, you have almost 4,000 bars all over St. Lucia where people recreate and have drinks. They too became unemployed or not having their livelihood affected, and the government of St. Lucia provided support to these individuals. The transport system, while it is privately owned, but it is a public good, the government of St. Lucia had to come up with support and to provide funds and support to licensed owners who provided transportation service. Moving forward, it is the purpose of my ministry to continue to advocate for a vulnerable population. The issue of reproductive and the health of our people, our young ladies, to see signs where they need the support. I've had meetings with the LGBT group in St. Lucia, as well as the faith-based organizations, because the ecclesiastic affairs also fall under my portfolio. But in addition to this, we have embarked to strengthen civil society. For the work that we do here is not possible without the support of civil society. The work of caring for vulnerable population is more than a government undertaking. And therefore, the government of St. Lucia will continue to support, mobilize, and advocate for a vulnerable population so that at least we can see within the medium term some improvement. It's difficult to align everything with the consensus and some of what is outlined in the consensus, but we will make an attempt to bring our goals and our aspirations for our people and report accordingly so that ECLAC could have full information as to what's happening in St. Lucia. And of course, we could continue to share with you. I wish to thank you, the partners and those who have organized this very important conference. I think as a new administration that we are almost 11 months old and have taken on the reins and responsibility for our people, I think your partnership and what you have shared over the past few days will go a long way in strengthening the resolve of our people in St. Lucia and of course the people in this part of the hemisphere. Thank you very much.
Muchas gracias, Joaquín. Y yo quisiera...
Thank you very much, Joaquim. I would like to add a detail that maybe seems not related, but maybe it is related. St. Lucia is one of the smallest islands that we have, and nonetheless, St. Lucia is the one that produces most Nobel Awards than we have. There are 2 Nobel Awards in St. Lucia. In none of our country that happens. Well, in Chile, yes. We have 2 Nobel Awards in literature, but a poet and an economist have Nobel Awards in St. Lucia. So they have a lot of imagination to move things forward. Now I would like to offer the floor to Maria Carmelina Londoño, Vice Minister of Multilateral Affairs of Colombia. She'll do it through a video that I assume is ready. Today, we meet to reflect about the impacts of the pandemic and the implementation of the Montevideo Consensus on population and development and the 2030 Agenda to learn lessons, good practices that will help us in a recovery inclusive, sustainable, and resilient for Latin America and the Caribbean. I invite you to think for one moment that what happens today is an aspiration that we all have, that is to become a region where everyone can develop their project of life independently from their religion, age, physical, mental condition, place of origin, where responding to the Montevideo Consensus, we can protect all the persons, and especially the most vulnerable ones. Let us think, for instance, about the migrants. an important population in our region. 42 million persons live outside of their countries of origin, and many of them in especially vulnerable conditions. This is why I would like to share with you the experience of Colombia given the crisis of migrants from Venezuela. There are opportunities for them, for our families, and for our own society, generating scenarios of recognition, of dignification, where everybody wins. And here I would like to highlight that we have chosen fraternity, generosity, and the defense of human rights. Because for us in Colombia, the commitment with human rights is shown, for instance, in not having second-class citizens. So I would like to mention some examples of those actions that reflect the spirit, the commitment of Colombia with the implementation of an open doors policy, carrying out important efforts to receive and welcome our brothers and sisters from Venezuela who have had to abandon their country, looking for better opportunities and the possibility of developing their life projects. We want to give a structural response to migration, prioritizing children at risk. This we have done it with a program called Childhood First. And we grant nationality to all boys and girls with Venezuelan parents, but who were born in Colombia to protect them. Until then, we have granted the nationality to over 70,000 boys and girls in the last 6 years. In the second place, we started with the temporal statute for the protection of Venezuelan citizens, an ambitious policy that regularizes more than 1 million Venezuelans in our country, and then they become subject of rights, just like the Colombians, allowing their access to many services that mean that they have economic, social, and cultural rights. As of today, a little bit over 1 year, we have already granted more than 1 million permits for temporary permanence to our Venezuelan brothers and sisters. But not all humanitarian aid is important, but also we need institutional capacity to favor the migrants socially and economically. We beg for that so we can make sure that our brothers and sisters from Venezuela come into the education, health, and social security systems just as Colombians, and they should have the same opportunities for employment, for instance. So the migrants can create a life project through which they contribute with knowledge, with skills, with new ideas to the development of Colombia as a welcoming country. And so together we can build the country we dream. We are sure that international communities play a very important role as agents for growth and the sustainable development of transit, welcoming countries and communities. So I would like to point out and congratulate ECLAC and UNFPA for helping implement the Montevideo Consensus. This tool should be the compass for the development of policies, and so that we can integrate efficiently migrant populations, and so that we guarantee that recognition, promotion, protection of human rights and enjoyment of human rights. This should be fostered by the international community to try to attain this internationally for a regular, orderly, and safe migration. Thank you very much. I don't know if what happened.
El agradecimiento por sus palabras, sobre todo porque
Thank you. There are some data where our civil society, we all need to bear in mind, and that is that there are 70 million migrants, and The border closures increased the breach of their rights, their administrative hindrances, informal employment, informal housing, difficulties in immunization, very difficult vaccination campaigns to reach out to migrants, 70 million. And in those, many are girls, boys, and adolescents. Well, now we would like to give the floor to Minna Cunningham, first Vice President of the Fund for the Development of Indigenous Peoples of Latin America and the Caribbean.
Muchas gracias.
Thank you, and I greet you from Nicaragua, from the autonomous region of the Caribbean northern area of Nicaragua, where we are preparing for an event, a climate event like those that have struck the Caribbean in recent years as a result of climate change. Today, it is an important day in the Maya calendar, and the topic of this meeting fits perfectly well with 09 of the Maya calendar. This number represents reproduction. The 9 moon cycles represent in some way all the situation you live after death, and the 9 days that you prepare to transfer the spirit towards a safe place. In my people, it's the ceremony of the cycle, but this number also represents pardon and the value of the word and harmony, something that was sought in the Montevideo Consensus. When we speak about the effects of the COVID-19 pandemic on the indigenous peoples of our region, obviously what we need to do in not only what the pandemic involved, but combination of the pandemic with structural factors that already had us excluded. And if we add to this the climate change and all the impact of climate change on our communities, but mainly the pandemic, we need to address it from the perspective of the persistence of an economic model that has involved greater pressure on our territories, greater pressure on our natural resources. The indigenous peoples, we've said that the pandemic, what it has done is evidence, make visible the enormous exclusion and racism gaps existing in our region. And that can be seen in the area of health, access to health, technological gap, when education became remote education or distance education, but also when we analyze the impact of the restrictive measures or lockdowns affecting most particularly the indigenous peoples living, or their livelihood is fisheries, agriculture, or on a day-to-day basis. Also, COVID served to prove the absence of data. Very few countries in our region disaggregated the data or the information of the COVID impact by ethnic gene. Really, in the countries, there's no information on how it affected the indigenous peoples. We see death, we see abandonment, but we don't know the amount because there is no ethnical disaggregation. In spite of the fact that events like this one where you're participating, it has or ethnic disaggregation has been accepted in most of our countries. And however, it's not implemented. So for us, indigenous peoples, the pandemic served to leverage our capacities. We realized that although the majority of states had abandoned us even before the pandemic, this was exacerbated even further, especially in those countries where still there is indigenism and individual rights of the collective of indigenous peoples are not respected, where there is no health system, for example, that prioritizes primary care and allows to reach out to families, especially those countries that prioritized secondary care and forgot about primary care. So we believe that the pandemic served to strengthen our traditional knowledge. We realized that using our traditional medicine, using food and medication that strengthen our immunological system, we realized that applying the right to self-determination and autonomy, we were protecting ourselves even further. So in that context, it's worth the while to analyze, in light of the Montevideo Consensus, what are the things that we as indigenous peoples were able to do from the local scope to internationally within the context of the pandemic. There were indigenous communities that organized themselves and strengthened barter exchange with other products of the forest, of the sea. Let us recall that the young indigenous peoples once again valued their indigenous language and produced information on the pandemic in their native mother languages. Let us recall the indigenous women that organized themselves and started to sew the face masks and teach the young girls to do it. Let us recall the indigenous communities that began once again to strengthen their productive and food systems, own food systems, but also let us recall the midwives that, in view of the abandonment of this health sector, they started to strengthen their traditional work of care for pregnant women. The indigenous youth started a process to evaluate the impact on mental health in their communities, on them as young indigenous peoples, and jointly with the indigenous women, were able to promote more curation activities, combining traditional forms and healing activities as indigenous peoples. When we examine problems of migration, sex, health, reproduction, of course, all these are cross-sectional for the indigenous peoples. They were the structural factors of exclusion were worsened, were exacerbated. Friends from Guatemala tell us that the migrants leaving Guatemala are precisely indigenous peoples leaving Guatemala. And there is a need to strengthen and apply or implement policies of food safety in those areas. Indigenous brothers and sisters told us that they worked with PAJO, the Action Plan of Youth, prioritizing sex and reproductive health. However, they don't find in each one of their countries interlocutors in order to implement that action plan. They tell us, or some indigenous communities tell us in a study conducted in Guatemala, Nicaragua, and Bolivia, that cases of diabetes mellitus 2 have been exacerbated or increased as a result of new food systems. So, given the pandemic, it's not only the pandemic problem, but new problems of non-communicable diseases have been added that call for the organization of services, intercultural services. A central aspect, a key aspect of these 2 years for the indigenous peoples is that of the environment, and very much linked to social inclusion. Amazonia and many indigenous territories have suffered enormous backwardness in rights to their land. A central aspect of the Indigenous Peoples chapter in the Montevideo Consensus, even brothers and sisters of Amazonia have called the whole world to save the Amazonia, because they are at the verge of non-return. Either measures are adopted to protect this forest, which is the lung of the world, or then really there will be no way back to protect it. However, what we have seen in view of the fight for land rights is greater criminalization of demonstrations. Our region has the highest rate of murders of indigenous and environmentalist leaders that are protecting their territory, their land, their waters. So when we analyze the Montevideo Consensus in light of the pandemic, we see that there are tremendous, enormous challenges that really are worth the while to consider. And we believe that it is urgent, really urgent, to establish a monitoring system of the Montevideo Consensus, but a joint system where indigenous peoples with institutions like FILAC that achieves parity between government and indigenous peoples to monitor jointly with ECLAC the Montevideo Consensus that will enable to create synergies between the Montevideo Consensus, the chapter on indigenous peoples, with the Ibero-American Action Plan of Rights of Indigenous Peoples. That action plan prioritizes 4 objectives. First, harmonization of the regulatory framework so as to reach the standard of human rights referring to indigenous peoples. Secondly, to work together jointly so that in the implementation of SDGs in the remaining years will reflect this intercultural approach of indigenous peoples as unique peoples with their own character, rights, individuals, and collective rights. Because if we are continued to be included in the vulnerable package or disabled package, of course, they are not addressing us with an approach of human rights. The third objective is the establishment of real, actual participation of indigenous people, systematic participation in each one of the countries. And the fourth objective is to prioritize the participation of indigenous women, fighting against all forms of violence that we, indigenous women, suffer. I would like to conclude recognizing that we have set up a regional platform of indigenous people to fight against COVID. We were able to articulate with different international agencies, and that role of building partnerships, pacts, and agreements in order to truly face the problems of the present crisis and structural problems, and that is key, has been key, and therefore we value the possibility of participating in this activity where we believe that the population and development, everything needs to be seen from a holistic, comprehensive, integral manner. If there is a lesson learned from the pandemic, is that no institution, no sector, no one can face a pandemic and the crisis we are suffering in our region in an isolated and disarticulated manner. All of us need each other, and to the extent that we can articulate that work, only then we will face inequality, exclusion, and reach social justice. Thank you.
Gracias, Mirna. Thank you, Mirna. A very interesting call to defend Amazonia and all territories, including Central American territories exploited by extractivism. To conclude and give the floor to the chair of this panel, I wanted to express one, the importance of timely and reliable information, its importance. Second, if we recognize the key role of the state in food, health, and education, we need to reach sanitary self-sufficiency, and we need to think in this respect. Ensure access to basic utilities to people, older persons. Nobody referred expressly to older persons, but they all referred as with childhood. Mirna said that's very true. It's true. When the state could not people, I am people. I'm not a state. The state is my state because I am a citizen. When the state failed, people moved. This is what the Afro-descendant population and many indigenous peoples there is to go back to communal knowledge and going back to ancestral roots in the best manner, not as a setback or to what the own community can provide support, and how can we move when borders are closed, when schools are closed, when we don't have water or vaccines, etc. Finally, it would have been excellent to be in a society of care when the pandemic arrived or reached. For the next pandemic, we should not be still thinking, how are we going to reach the society of care? We need to go now to the society of care. Otherwise, we will lose a lot again. Thank you. We will lose a lot again. We thank Dulce Garrido and the speakers for the diverse contribution that they shared with us. Diana Miloslavich, Gabriela Rodriguez, Patricia Muñoz, Maria Carmen Dina Londoño, Joachim Henry, and Mirna Cunningham. Now we open the floor for the delegations. We are going Delegation of Cuba. Good afternoon, and thank you, Mr. President. Very briefly, I think the essential, everything has been said by the speakers, and moderator. We are used to receiving the very specific comments from Lucy. This relates to intervention on this morning. We do not know the real dimension of the impact of pandemics in our society and the livelihood of our population. We can know that there are more deaths, less mobility, less birth rate, the impact on families and children, gender-based violence, everything that has said here, but the real, actual impact, we do not know them still. This has not ended. We have outbreaks and we want to live, and this is why government, state, we flexibilize, but we need to be very attentive to what is coming next. I said this because yesterday I was talking to a friend and she told me there is a variant number 5 of the COVID viruses. Now everybody, life forces us to become expert in virology. So now we know we were informed about Peru, Mexico, St. Lucia, and all the intervention, I could say, in my country to be able to control the pandemics and everything related and try and reorganize the society and for most vulnerable population. There's a massive application of science, innovation, technology, the academia, and because we need to think, because problems are different. What I want to mention here is there are things that we know. And I was reading the resolution draft resolution. If we will be able to meet next year for the 10th anniversary, or in your country, the meeting of presiding officers, we will need to have more deep knowledge and thinking by assessing the whole impact in the panel in this morning, and the panel this afternoon has provided a lot of information of what we can do and how we can move forward. Thank you. We thank the intervention of the Delegation of Cuba, and now we give the floor to Delegation of Antigua and Barbuda.
On behalf of the government of Antigua and Barbuda and the Ministry of Social Transformation, Human Resource Development, and the Blue Economy, I would like to take this opportunity to thank the President, the Chair, CPAL, and UNFPA for the invitation to be a part of this 4th Regional Conference on Population and Development in Latin America and the Caribbean. Good day to all delegations, civil society organizations, youth representatives. Great presentations by the panelists. As stated by many delegations over the past 3 days, especially my counterparts in the Caribbean, some of the progress and gains that were achieved by the Montevideo Consensus Agenda were negatively impacted by COVID-19 pandemic. The conclusion of our country's second labor force survey in 2018 indicated our unemployment rate at 8.7%, with 71% of our working population employed in the services and tourism industries. That particular sector were the most impacted, as we saw high surges in unemployment due to the pandemic. This also caused a ripple effect as we experienced decline in our country's GDP, being a tourism service dependent small island developing state. The strain on the health sector highlighted our limited resources, such as beds, ventilators, PPEs, and hospitals. It also highlighted an increased demand for healthcare professionals and additional services, inclusive of mental health and psychosocial support, geriatric care, and sexual and reproductive health. The education sector also experienced its own unique set of challenges, with the closures of schools, some privately owned schools remaining permanently closed to date, and subsequent remote and hybrid learning. Issues in relation to increase in poverty, which we anticipated to rise based on our last CPA, country poverty assessment, to be approximately 28.3%, would have resulted in persons who were deemed just above the poverty line falling into poverty. However, we can imagine now this our poverty assessment is dated, so that number would have been even much higher. There was and still remains increased demands for social protection assistance and for other social issues such as childcare and protection, substance abuse prevention and rehabilitation, and gender-based violence. As of June 2022, Antigua and Barbuda, with an approximate population of 1,772 persons, have had 8,625 COVID cases. Of that, we had 141 deaths, and we have 58 active cases. Within that particular grouping, children between 0 to 18 years old, we have had 1,064 cases. And for the elderly population, 65 years and over, 785 persons. Of the 141 deaths, confirmed COVID deaths, 86 were the elderly population, which were mainly affected due to underlying conditions such as non-communicable diseases, respiratory problems, and of course, because of their age. On the other hand, despite the resistance, public fear, and the risk of violating the basic human rights of our citizens, the government of Antigua and Barbuda, as of June 2022, have been able to vaccinate 75% of the total eligible population ages 12 years and older. Of that, the fully vaccinated currently stands at 62,031, and the partially vaccinated remains at 2,060 persons. There were several interventions implemented to deal with the impact of the global health crisis. A substantial increase in the health sector expenditure, equivalent to 0.5% of our GDP, was directed to purchase of critical medical supplies, equipment, and for additional personnel. There was an implementation of up to 25% reduction in electricity rates to the public and fuel costs for fisher folks and the transportation sector. The provision of public utility waivers in terms of fees, penalties, were afforded universal coverage to all households. There was an introduction of a one-year investment incentive framework for home renovation and construction design to stimulate growth and employment in the labor-intensive sector. There was a suspension of the common external tariff on food imports to further reduce the cost of living and ensure food and nutrition security. There was a suspension of all new taxes as announced in our budget in the year, at the end of the year of 2020. And there was a further expansion of social safety net programs. The implementation of the COVID-19, the government emergency food program, included food packages. And in addition, we had an assistance program that offered cash transfers and food packages, and also a voucher system for those who wanted the option of going to the supermarkets and the various vendors to buy their own food supplies. Though that particular program of cash transfers, food packages, and food vouchers, the government assistance program continues to date. Food and care packages included diapers and formulas for young moms and their babies. Both programs were designed to assist the poor and vulnerable households, especially women, elderly, unemployed persons, persons with disabilities, and households with children. The provision of universal access to sexual and reproductive health services and access to HIV care and treatment led to alternative measures such as appointment-only systems and the institution of mobile and delivery services, which continues to date. There was also direct funding to support business model transformation and the digitization of small to medium enterprises. The school meals programs continued during the various lockdowns and remote learning by a delivery distribution method. And that method will continue into summer 22 school, the summer 22 present school vacation period to all children in the public schools at the early childhood and primary levels. Also, students and teachers were provided with computers to facilitate remote and hybrid learning. Currently, our schools are operating in education recovery mode, which will facilitate classes and in a shortened version during the summer vacation. The unemployed youth who are attached to all of our job programs, temporary job programs, as a part of our active labor market policies, continued to be paid whether they were temporarily employed or not during the pandemic. We also launched a national seedling distribution through our Ministry of Agriculture to encourage a wider expansion into backyard gardening. Our Engender COVID-19 support was extended to survivors of gender-based violence in the form of cash transfers, food and personal care packages for tourism sector workers and our informal sex workers. The Ministry of Social Transformation was able to provide cash transfers and food packages during the latter part of 2021 and early 2022 through donor support from agencies such as UNICEF and its international partners and UNDP. The Ministry of Social Transformation repealed its 1961 Poor Relief Act and enacted a modern and new social protection legislation, the Social Protection Act of 2020, which was designed to strengthen our social protection mechanisms and improve our overall social services delivery to poor and vulnerable households and individuals. One of the most important points emanating from the report of the socioeconomic effects of the pandemic, which was presented earlier this week, which rings through for most of the Caribbean territories, is the absence of unemployment benefits or insurance for formal and informal sector workers. The establishment of an economic impact payment or stimulus mechanisms will be critical in instances such as the COVID-19 pandemic or any future health pandemic, natural or man-made disaster, or future economic crisis, especially for small island developing states who are tourism dependent like Antigua and Barbuda. To this end, Antigua and Barbuda too confirms its commitment to the Montevideo Consensus, and later this year, we will be conducting our third labor force survey, and in 2023, our population and housing census, which should have been conducted in 2021. This would further contribute to the Montevideo Consensus agenda. And with this in mind, we are of the ideology that as we continue to navigate with a holistic and integrated approach to inclusive social development, we work towards the overall social development agenda of 2030. Thank you.
Agradecemos la intervención de la delegación.
We thank the delegation of Antigua and Barbuda for that statement, and now we will move on to the delegation of Colombia. Thank you very much, Chairman, and special greetings to the moderator and other members of this excellent panel. I would like to begin our intervention picking up on the reflection by the moderator in that it is important to recognize what we did not do. And in that sense, the Montevideo Consensus becomes a very important milestone in order to determine which are those critical elements that we must give priority to as societies in the recovery of the social and economic tissue in our countries. We also would like to especially greet the representatives of the various UN system bodies, the national delegations, civil society organizations that have been very much present, as well as the academia and international cooperation agencies. In Colombia, we believe that what has been seen throughout this fourth regional conference on population and development in its working documents, as well as the very valuable statements by everyone here, is at the heart. It is at its heart that the pandemic left us not only as a lesson that we must improve our national systems in order to address this sort of crisis, but that our population has degrees of vulnerability, high and heterogeneous, that must be learned and addressed from various fronts, such as health, food safety, labor, housing, education, information and communication technologies, among many others. Likewise, the pandemic continues to underscore the historical difficulties that some populations face in deference to others, and so we need responses that are specific and differentiated for women, girls, boys, adolescents, Afro-descendant women, indigenous people, by sexual orientation, diverse sexualities, and others. As was pointed out by the Vice Minister, Colombia has made tremendous efforts in order to, with its institutional offer, address these populations to help them overcome poverty and keep them at a level where with less vulnerability. However, the example of international migration that sharpened in the region and that by 2020 represented a total of 43 million people foresees that new challenges will continue to appear and will vary in both magnitude and complexity. This, once again, opens the door to the need to implement regional and international mechanisms because these are a way to address the various entities in our states in order to integrally respond to the needs of our population. Likewise, and with this great panel, the statements that we have heard all the way from Colombia, we would like to highlight the relevance of strengthening the national statistics system so that it may be possible to have reliable and timely information to inform the progress made with regard to the implementation of the Montevideo Consensus. In order to move ahead with the implementation of our commitments, I would like to recognize that we already have a community of excellence as we are living today that recognizes the relevance of sharing experience and that is ready to join efforts based on the interdisciplinarity and efficiency in order for which we have excellent connection to the UN system at regional level and in each one of our countries. Yet again, we highlight that the Montevideo process on population and development is more valid today than ever before, although we need to innovate in the ways, the methods, and the technologies, as well as address new difficulties that can be seen in the period post-pandemic. It is necessary to recognize that the causes of these challenges continue to exist and that it is necessary to have urgent action, but above all, coordinated action in order to move ahead. And that is why in Colombia, we call on you to continue wagering on implementing the Montevideo Consensus and international community to continue to support the national efforts made by each Latin American and Caribbean country in order to have safe, prosperous, and resilient societies within the framework of the principles of the Montevideo Consensus that for us are very important, universal, cross-cutting, and integral, inclusive, based on solidarity, equity, and decency, as well as human rights based for servicing all groups living in vulnerability. Thank you.
Agradecemos la intervención.
We thank the delegation of Colombia for that statement and will now move on to the statement by Argentina. Thank you, Chairman. First of all, in Argentina, we would like to greet this meeting, the relevance of this meeting, the relevance that our region should continue to maintain an agenda which is at the forefront and that the Montevideo Consensus is the basis and not a point of arrival, but rather the basis based on which governments must begin. And in that sense, I think it is very important here on, and with a view to the global discussions that are on the way, that our region may continue to maintain advanced positions at the forefront and for the advancement of rights. I would like to greet all delegations taking part and the multilateral agencies, and as well as civil society organizations. And reading the document, we will observe paragraph 4 because we believe that this could give rise to a misinterpretation. Thank you very much. We thank the delegation of Argentina for her statement, and now we'll move on to the statement by Costa Rica. Unfortunately, the speaker's microphone is muted. Thank you. I apologize. My microphone was muted. Thank you, Chairman, and I thank the excellent panelists, ladies and gentlemen, for such relevant comments and learning in the framework of the pandemic. The degree of affectation of the implementation of the Montevideo Consensus on Population and Development and the SDGs with the 2030 Agenda. There have been many challenges and social and economic, environmental impact in this period, and that began in Costa Rica on March 6, 2020, and that still we continue with these effects and repercussions after the pandemic, effects that enhance the gaps that you have been mentioned by you, that gaps that has existed for decades, and new sectoral, territorial, and population gaps that became evident, especially those living in greater vulnerability, as has been identified here, and where today the states from around the world must seek actions that in the short and medium term lead to a greater economic reactivation, comprehensively, equitably, and better social conditions, and putting an end to educational gaps, also health, sexual and reproductive health, security for the entire population, and especially for women, girls, boys, and persons with disability, the elderly, indigenous people, and Afro-descendants, and invest in a better way and more in science and technology and ICTs. As the region was investing prior to the investment to the pandemic, but hopefully in better conditions now. And hence these effects that have already been addressed and that have affected the implementation of these agendas for sustainable development and population. We have recognized significant setbacks that on average could be of around 10 years in some variables or statistical indicators, but that in others are definitely a setback of more than 2 decades, and within a very challenging context for future actions related to the Montevideo Consensus and the SDG.
We have little resources and we have more and more needs for the compliance of the human rights of the population. Resource scarcity that invites to innovation, efficacy of the public interventions like the generation of policies, plans, and programs and projects with a positive impact for the development of our societies in the framework of strategic alliances of all sorts: public, private, public, academia, public, civil society organizations, United Nations organizations, and other organized sectors of the population, so that together we can come to a consensus and a roadmap that help us implement and operationalize the Montevideo Consensus and the 2030 Agenda in order to have a full human rights approach. It is a big challenge, and this has been assumed by the Ministry of Planning and Economic Policy, public institutions of all kinds and all the powers of the state, organizations of the civil society, the academia, and especially associated with the UNFPA in Costa Rica. With all of them, we have presented a country report during the pandemic in 2020. This allowed us to innovate in the methodological processes presented in the first report of 2017. And this has allowed us to continue in non-pandemic times and pandemic times. We have been able to continue building indicators for the follow-up of this agenda. All these tools, we hope, will become official in the second semester of 2022 or beginning of 2023. This would allow us to continue to contribute with possible good practices that all the present states believe are feasible, be able to leave no one behind. Thank you. Thank you to the delegation of Costa Rica. Now, Daniel Paitao, representative of the Afro-Descendant Youth Network of Latin America and the Caribbean. Lo lamentamos, pero no hay. I'm sorry, but we do not have translation from Portuguese. We apologize for this.
Juventudes afrodescendentes da América Latina e o Caribe, espaço regional de diálogo, de articulação e incidência política para assegurar e impulsar o cumprimento de los marcos normativos internacionais, nacionais e regionais de promoção de la igualdade e garantia de los derechos de las juventudes afrodescendentes, em o marco de la quarta Conferência Regional de População e Desenvolvimento, reafirmamos nosso compromisso com o Consenso de Montevideo. Observamos com grave preocupação a situação de nossas juventudes afrodescendentes, as quais representam aproximadamente a 36,5 milhões de pessoas em la região, sendo estas, elas se encontram em maiores condições de desvantagens, exclusão, discriminação e em cenários de violência estrutural que o resto de seus pares, as quais se han agudizado durante a pandemia da Covid-19. Reconhecemos que aquelas interseccionalidades de ordem étnico, econômico, social e intergeracional, assim como as emanadas pela condição de gênero, orientação sexual, discapacidade, mobilidade populacional e segregação socioterritorial repercutem de maneira negativa nos direitos de acesso à educação, à vivência digna, à infraestrutura de saúde, justiça, como também em la provisão de serviços públicos de telecomunicacionais. Todos esses resultados de las desigualdades sistêmicas e estruturais que se materializam bajo a forma de racismo, xenofobia, capacitismo, misoginia, criminalização e outras formas de discriminação. Por isso, exigimos a los estados e a cooperação internacional a que cumpram com seus compromissos e continuem trabalhando plenamente, intensificando seus esforços na luta contra o racismo, a xenofobia e as formas conexas de intolerância, como é o fortalecimento da participação ativa de las juventudes afrodescendentes. Demandamos a inclusão de perguntas de autoidentificação para a população afrodescendente e o censo de população e vivenda e demais registros administrativos de maneira desgozada, já que se trata de direito fundamental para reconhecer as condições de vida das populações afrodescendentes, especialmente suas juventudes. Exigimos o reconhecimento, acesso e garantia de los direitos que, como seres humanos, nos correspondem e que são assuntos fundamentais para alcançar a justiça social. social, a igualdade, a democracia e o desenvolvimento sustentável de nossas comunidades. Por isso, se hace necessário que as ações que correspondam às necessidades específicas da população e comunidades afrodescendentes de América Latina e ao Caribe são exportagáveis, por lo qual os governos assistentes a esta conferência devem impulsar modelo de desenvolvimento integral e equitativos que permitam transformar os imaginários coletivos, assim como alcançar a eliminação do racismo e para avançar o cumprimento de los direitos. Solicitamos que se garanta nossos direitos ao acesso e desfrute a uma saúde pública de qualidade, como também aos programas de prevenção e controle de enfermidades. Exortamos que se garantisse o direito à cidade, que não é mais que o disputa integral e humano que lá Rubem, lá qual antes dos processos de especulação imobiliária e de renovação do espaço aberto, ha fomentado práticas de exclusão e segregação espacial de quem nos reconhecemos como afrodescendentes. E nossos direitos apropriamos de las cidades e de los recursos econômicos, políticos e sociais que assim se encontram para poder garantizar a realização de nossas expectativas de vida individual e coletiva. Ademais, demandamos de respeitos aos direitos culturais, tradicionais, coletivos e diversas formas de vidas comunitárias em los espaços rurais. Exigimos a inclusão de programas etnoeducativos que fomentem o reconhecimento e orgulho da afrodescendência entre os membros mais vulneráveis de nosso povo, os infantis. Pois o presente em nossas e é nossa a obrigação como juventude, a construção de um futuro para que eles continuarem nossa luta por a liberação do povo negro. Entendemos os retos e desafios que involucram avançar na agência do consenso de Montevidéu. Portanto, seguiremos monitoreando, exigindo políticas de avanço e denunciando os retrocessos em nossos direitos. Rede de Juventudes Afrodescendentes da América Latina e o Caribe. Muito obrigado.
We thank the statement by Daniel Paitao. Now we will listen to the delegation from Suriname.
Thank you, Mr. President. Good afternoon, everyone. I'd like to thank the distinguished panelists for their presentations. I think we can all agree that it was a very informative meeting. We were now better informed about the social demographic impact of COVID-19 in the region and what our specific challenges are and the possible consequences for the region. As I said in my statement yesterday, Suriname is committed to continue in the spirit of the Montevideo Consensus, and I want to encourage the rest of the region to do the same, as this brings us closer to achieving the 2030 agenda. From July 1st till the 31st of December, Suriname will have the important responsibility of chairing the Conference of Heads of Governments of CARICOM. Suriname will efficiently and actively manage this position with vision and initiative in order to realize our regional goals. In the so-called quasi-cabinet of CARICOM heads of government states, Suriname's portfolio focuses on gender issues, youth, sport, and culture. Suriname will take this opportunity to promote further implementation of the consensus in the Caribbean region. And we therefore once again reaffirm our political will to the Montevideo Consensus. Thank you.
Agradecemos la intervención de la delegación de Surinam. Ahora vamos a dar paso.
Thank you for your statement. Now, Ecuador. Thank you very much, Mr. Chairman, and thank you also to all the delegations that have participated during these days of meetings and work. From Ecuador, from the delegation of Ecuador, we are pleased to listen to all the debates that have been held during these days. We've heard about the different efforts carried out by the countries in the implementation of the Montevideo Consensus in a very difficult context, which is the context of a COVID pandemic. This pandemic implied the generation of barriers that didn't allow us to advance in protecting the rights we want to protect with this consensus. In some cases, we have heard about important setbacks. There are dramatic data like this setback of 18 years in life expectancy, as we heard in some sessions. And also this has affected different groups of the population in our countries. Therefore, we believe it is important to reaffirm the Montevideo Consensus as a roadmap to recover, but we also believe it is very important. Another word that appears in the documents is that we do not only have to achieve a recovery, but also a social and economic transformation, because we do not want to go back to the state we had before the pandemic. I think that as countries, we have to learn that we want to go beyond. We cannot go back to the same. And that has to be reflected in the information system and the monitoring systems for the compliance with the Montevideo Consensus. And we need to go deeper in the debate regarding which new metrics will be used for the follow-up of the goals proposed by the Montevideo Consensus. We've heard from different delegations and countries the amounts of investments in different activities and the impact on GDPs, but I believe we also have to make progress regarding how we measure not only the amounts of the investments, but how these investments help equity or have an impact on equity. So we have to think about new metrics that will really allow us to measure this progress in equity. For several years, there have been criticisms to the use of indicators like the GDP as the single indicator of economic growth of the countries. And I believe that this is an opportunity to reflect again regarding whether those metrics really allow us to measure what we want to measure. And I would like to conclude by highlighting the fact that many of the indicators related with the different groups of the population that we want to protect have to become indicators that allow us to do an analysis from an intersectoral perspective, how ethnical identification, the aspects related with gender, economic aspects, and educational aspects, how we can do a crossover in our monitoring system for the implementation of the Montevideo Consensus.
Once again, to achieve greater equity. And I would like to finish launching one alert, and that is when we speak about self-sufficiency, we cannot think in self-sufficiency as within our territories, but it is that our self-sufficiency calls for regional synergies and capacity building at a regional level that will enable us or will allow in a different situation, in a new pandemic, to be much better prepared and really raise this objective of having societies that are care-centered and a region, I would say, centered in care. Thank you. We thank the intervention of Ecuador, and having already received all the presentations, now the members of the presiding officers will consider and adopt the this part, the agreement. I will give the floor to the secretary. Thank you, Mr. Chairman. There are two agreements. Yes, we have the draft resolutions and the agreement on the presiding officers that will lead the work of this conference in the next 2 years. I will refer to the latter. The first day of the meeting, we elected by acclamation, we elected Bolivia to chair this fourth conference and the work of the next 2 years. And we invited delegations that were interested, willing, had the energy to accompany Bolivia in this endeavor. And thus I will read 11 delegations that have offered to be part of this presiding officers and will celebrate 10 years of the Montevideo Consensus. And the delegations are Argentina, Chile, Cuba, Honduras, Jamaica, Mexico, Panama, Peru, St. Lucia, Suriname, and Venezuela. Once again, I ask again, can we approve by acclamation this presiding officers, this board? I mean, you, all right, we hear the leader and that's it. By acclamation. On the draft resolution, some procedural information. First, to say that the Secretariat, by instructions of the previous chair, the first draft was circulated on the 16th of June, and until the 22nd, it was open to receive comments, and we received from Argentina, Costa Rica, Mexico, and Uruguay, and they were all supplementary, and they were included, and they were distributed in a second version that was distributed on June 25th. During this meeting, having circulated that version, some suggestions were received from Argentina in paragraph 30, from Brazil in paragraph 15, from Uruguay, paragraph 4, and from Guyana in paragraph 6. With all that information and having circulated this draft resolution to be read by all delegations, and this was circulated an hour ago, are we ready to adopt the text as you have it in your folders, in your desks? Peru. Could we give a few minutes to Article 4, given that is it enough to have a change in wording, or would it be possible to not include it? If there is no other, is it about the same point? Yes. Paraguay is on the same item number 4? Yes. For assurance, are we ready to approve or adopt the rest of the text? If so, we approve it And please, it is then adopted, and we have 95% of the draft resolution approved, and now we can discuss item number 4, which was a contribution made by Uruguay to this consensus or to this draft resolution. Dominican Republic. If I understood, you said that improvements on wording were received for some paragraphs, 15, number 30, and others. However, paragraph 4 is one that was not in the last version. I requested the version this morning, and I was told that the same one we had of June 24 was in circulation. So what I understand is that in a context, and what paragraph 3 says, all the COVID-19 pandemic, from the point of view of Dominican Republic, paragraph 4 should be deleted because it's not in accordance with what we are discussing today. Paraguay. Thank you. Unfortunately, against the view of the Dominican Republic, we request that this paragraph be included, be kept. It is very important to point out the role of families and the help that families should receive. We agree with this wording proposed by the Uruguayan delegation, and we believe it is sufficiently broad to accommodate all the opinions. Thank you. Thank you. I would like to give the floor to Argentina, that at some point had anticipated a view on this. Please, could you share with us? Yes? Yes, we support deleting this paragraph. I think it is a procedural paragraph that is not in accordance with the rest of the resolution, that could be misinterpreted or be or moved to backward situation. Any other delegation would like to take the floor? Honduras. I share the criteria on paragraph 4. I think this should have been shared previously, and it is out of context. So I support those colleagues that are asking for the deletion. Please let us not make any demonstration about the contributions made by one country or another country, so as to move forward. Is there any other intervention? Perhaps Uruguay would like Canada? Yes? Yes?
Canada would support Argentina and others in its deletion. Canada would support Argentina and others in its deletion.
Muy bien. México.
Mexico. Paragraph 4, it would be perfect, recognizes the crucial role of families, irrespective of their composition in the development of the countries of the region, period. Period. The rest is not right. The region, period. We have scientific evidence, Uruguay, we have scientific evidence of the need to work with families in order to move forward the Montevideo Consensus and the Sustainable Development Goals. That is why we submitted this proposal. No doubt that when you expect from adults, it's care, its protection, its guiding. And instead of that, you receive violence. I can tell you that 90% of the reports of violence or the accusations of violence is inside the families. I mean, the family members are the aggressors. So that is why I say that it is very necessary that we work with the families. Can I ask you directly about the proposal of Mexico? Yes, please. So I ask all the delegations in the room if, thanking Mexico for your proposal, paragraph 4 would say, just as Mexico recognizes the crucial role of family, irrespective of their composition in the development of the countries of the region, period. Could it be approved as such, like that? Paraguay. Thank you, Chair. Yes. I think we can support if we say we recognize the crucial role of families irrespective of their composition in the development of the countries of the region, and the need to incorporate public policies aimed at providing families with tools to support the development, period, that development. The proposal is based on the fact that families, we believe that, as the distinguished colleague from Uruguay points out, families need support from public policies in order to fulfill their fundamental role. Thank you very much. Any delegation would like to refer to this second proposal? So we have first, we have 3. 1, deletion. Number 2, a period after countries of the region. And the third alternative is to providing families with tools to support their development. I think we had already left out the possibility of deleting based on the Mexican proposal of saying countries of the region. So my question is, the incorporation of this sentence, would this facilitate the approval of the paragraph 4 if it says until tools to support the development, period? Dominican Republic. Thank you. Dominican Republic would agree with the Mexican proposal, that is to say, of the countries of the region, period. With that proposal, we agree.
Argentina, we concur with Mexico. Canada?
Canada agrees.
With Argentina's proposal, which is Mexico's proposal? Okay. I understand that Uruguay also. So Paraguay, it is possible to go, and the resolution is with the development, the crucial role of families, so irrespective of their composition in the development of the countries of the region. We concur with the proposal, but noting that we think it's a bit short, but for consensus and the good understanding among countries, we concur with the proposal. We thank Paraguay, Uruguay, and all the delegations. Then we have the resolutions approved. Now is the time for the closing of this fourth conference. And please stay. And I have the pleasure to give the floor to Raúl García Buchaca, Deputy Secretary General of ICLAC, for the closing ceremony. Good afternoon to all of you, and it's a joy to be reaching this point with the approved resolution. Mr. Carlos David Huachaya, Vice Minister of Planning and Coordination of the Minister of Planning and Development of the Plurinational State of Bolivia and chair of this the chair of the presiding officers, dear Minister, dear Harold Robinson, Director of the UNFPA, and delegates, representatives, or the organizations of the civil society very well represented here, colleagues from the system, the United Nations system. I see representatives for the FAD and other bodies and agencies of the United Nations, dear friends, and ICLAC. It is really emotional, and it's with great satisfaction that I share this closing ceremony of all very fruitful works of the fourth meeting of the conference, the Regional Conference on Population and Development of Latin America and the Caribbean. After not being able to meet for 2.5 years, we are all together here to start the regional conference with a very ambitious and demanding agenda. 3 very productive, intensive work days in which the session has been complemented with parallel and very interesting events and very rich one, and also preceded by with the activities and gathering of the social civil society and parliamentaries present. Now we are again meeting face to face and to recover what the pandemics try to take us away, which is the human dimension. That screens and technology, at least at the level of this development, will never give us. Want to congratulate each one of the delegations of the countries that share their public policies, the answers to the pandemics, and other important thoughts.
In population and development matters, and the importance of generating evidence and statistical information on population and development subjects. We know that that is not measured, does not exist. And also point out and highlight the participation of civil society, of the youth, in all of its diversity. They are the ones that in core urge us to implement concrete actions that will contribute to make this consensus of Montevideo a reality, to materialize it. And they've organized very well, and really they've been clearly and strongly and loudly, they've been heard. This is a voice claiming justice, equality, non-discrimination, rights, and sexual and reproductive health. Thanks to the panel members that have accompanied us, have contributed their analysis, and to the directors of ECLAC that have shared their perspectives from the different departments and bodies of ECLAC, contributing with very important interoperability interoperability, as pointed out by our colleague from Dominican Republic, and many intergovernmental processes like the Conference on Aging and Rights of the Elderly in Latin America and the Caribbean, and the World Pact on Safe, Orderly, and Regular Migration. All of them constitute a body of conferences, of actions, of synergistic intergovernmental actions. 4 years have elapsed, and a tremendous, awful social, economic, health tragedy in the region. And we are once again closing this conference with a resolution agreed unanimously, committing us all to double our efforts and to to implement the 2030 agenda, leaving no one behind, and to achieve all the sustainable development goals. Once again, our full commitment with the Montevideo Consensus, with the action plan of El Cairo, the consensus that continues to be, together with the 2030 agenda, the indispensable tool to undertake the tasks of this recovery, but not any recovery. It has to be a truly transformative recovery that places equality, that places sustainability and the persons in the center of our priorities are the girls, the boys and youth, the elderly, the sexual and reproductive health, women, persons with disabilities, migrant persons, indigenous peoples, Afro-descending populations, and the sexual diversities among other groups of population that are much more prone to fall in vulnerability situations. I believe that with the strength and the success of this conference, once again, the priority measures of the consensus were placed in the core, in the center of the regional debate. And I'm so very pleased about that. So we conclude with an ambitious working agenda. Yes, to make equality and rights of the population a reality, inspired in the imperative need of addressing the transformation of this Latin America and the Caribbean with such unequal features that shows today the scars left by the pandemic with long-term consequences, as we have said here. We still don't know what's the true scope of them. Until when will they last? And I will take 1 minute to really say what are the landmarks of our working agenda and that will be undertaken by the new presiding officers that have been elected today, and that we see that they should focus their actions in the 5th Regional Conference on Population and Development next year in 2023, yes? And so we will also prepare the 2nd and 3rd voluntary national reports on the implementation of the Montevideo Consensus in the countries of the region. We will celebrate, and this is very important, we need to give room for celebration, the 10 years of the Montevideo Consensus next year, and the 30 years of the action plan of the National Conference on Population and Development. We committed with updating the virtual platform for the monitoring of the Montevideo Consensus developed by CELADE and presented today by Fabiana this morning. Of course, we will prepare the 2nd regional report on the implementation of the Montevideo Consensus, and we will present it at the 57th session of the Commission on Population and Development in 2024 as the Latin American and Caribbean contribution to the examination and evaluation of the CIPD after 2014. So, dear friends, this conference is about persons. It's centered in persons, and it is for persons. Having arrived to this point is the result of a joint work between governments, civil society, international organizations, and academia. We are fully satisfied that the very high participation is one of the characteristic imprints of the conference. The hybrid format with which we have worked in these 3 days has also allowed us to have a participation of more than 1,360 people. 1,360, and more than 600 have been face to face, even though we have not left the pandemic behind. We have had the participation of 30 countries, member of ECLAC and an associated member, and civil organizations, 10 agencies, funds of UN, and 16 intergovernmental associations. To the social media, YouTube, Twitter, Facebook, and Zoom, we were followed by 5,107 persons on Tuesday and 3,016 on Wednesday. So I take this opportunity to greet everyone and those following us in the media.
Now is the time to give thanks. First, I want to thank the population, the Fund for Population Activities, our strategic partner, our historic partners, in the person of Mr. Harold Robinson, who is that in this the Fund for Population Activities is the custodian of the Montevideo Consensus. I want to thank Harold for his leading role to promote the rights of all in the region, Florbela, Fernandez, Juan, Jose, Calvo, and each and everyone. I am missing somebody. Each and every one of the directors of the, well, I miss a lot, but you're all included. But I wanted to do I wanted specifically to mention all directors of national offices. Today we were discussing the importance of national offices, and also thank the chair, the outgoing chair of the government of Peru, in the person of Minister of Women and Vulnerable Populations, Madam Diana Miroslavich, for this almost 4 years of intense work to continue to foster the Montevideo Consensus. Thank you very much for your drive, your strength in such a difficult times. You were up to the task. To the coming chair, the government of the plurinational government of Bolivia, in the person of the Minister of Planning in Bolivia, David Huachaya, who will lead the job, the work of, with all the CITES that we mentioned, and each and every one of the government of the region.
Because your commitment, without that commitment, without that endeavor, without that political will, it would not have been possible to get this far. And hearing of all these successes and the challenges still to be faced, but reaching these very sound agreements that are enshrined in this declaration. Our deep thanks to the civil society organizations, the commitment with equality and the defense of the rights of all, and especially population groups living in vulnerability, this continues to be the spark, the soul of this space of consensus. And also, I would like to thank the ECLAC team that has made this conference possible. First of all, our colleagues and the Commission, Luis Yáñez, Jimena Sanchez, and he corrects himself, Jimena Arias. Jimena Arias. I confused you with another Jimena. Jase, María Flores, María Gatica, Javier Pérez, and Enrico Oviedo. Roman Sevilla and the team at the Executive Secretary's office, Sanjo, and the team of the Document and Publications Division, the team at the Unit for Public Information, David Moral, and the people in ICTs, and Maria Eugenia Johnson, and the team of the conference services, Lucia Concha, Alejandro Morales, Marco Santander, and Claudia Yáñez, and the team of security led by Eduardo Freitas and my own office, Beatriz González and Pamela Lagos. And also thank, this is very important, the interpreters, Spanish, English, and French, and the sign language interpreters who are allowing us to take these first steps towards a conference that is inclusive, truly inclusive. And of course, the extraordinary effort, excellent and without rest of the team at the CELADE Population Division at ECLAC, which is the technical secretariat of this conference. Most especially Simone Cecchini, the director. Thank you, Simone, for your leadership. Pamela Villalobos, Fabiana del Popolo, Zulma Sosa, Leandro Rebóvidas, and Omar Bey, Elena Cruz, Lenia Aguinaga, Guillermo Herrera, Olivina, Jorge Rodríguez, Daniela González, Uribel, Jorge Martínez, Sebastián Carrasco, Carolina Cavada, Alexandra Martínez, María Cecilia Villarroel, Verónica Cas, José Enrique Monteiro, Marco Rovira, Antonia Atria, Celine Van Herp, Anita Miranda, María Esther Novoa. And I hope I've not forgotten anyone. Well, that's quite a list. So a big round of applause for this team. Thank you very, very much. We will continue to work, everyone together, and we see you in 2023.
Muchas gracias, Raúl. Antes de darle la palabra.
Thank you very much, Raúl. Before handing over to Harold, I would like to make a correction and say that about 600 times we've said Montevideo this time, and the Secretariat forgot mentioning Uruguay as a member of the presiding officers of this new administration. And so with those apologies, and Uruguay, well, at the very last minute, but the match was not yet over, yes. And also I would like to recognize them. If in Santiago he would be here at the panel, Santiago Baeza, the Director of UN Women. And now, yes, I will hand over to Harold Robinson, the Regional Director. Thank you, Luis. I would like to greet Juan Carlos David Bacaya, Raúl García Buchaca, the Deputy Secretary of ECLAC, heads of delegations of the ECLAC member states, the members of Congress, ECLAC colleagues, and the UNFP team who's here, UN system colleagues, organizations of the civil society attending the meeting. Well, we're coming to the end of 3 days of very intense and productive work and that have allowed us to analyze the main consequences of the pandemic and the region and share the challenges for the future and the responses that our countries planning to implement to face them. These have been 3 very fruitful days of exchanges between core organizations, countries, governments, academia, and civil society. For the last 4 years, since that first meeting in Lima and with a pandemic in the midst, it has been difficult to foresee which was going to be the turnout at this conference. But we must say that the outcome, from our viewpoint at least, has amply exceeded our expectations, with more than 1,300 attendants online and 600 in person. A high-level representation by countries and the civil society. And likewise, there have been statements and exchanges, excellent. All statements by countries, delegations, reports on activities, the new instruments presented, the different panels, and the very rich discussions with the civil society have led us each time with more knowledge, more commitments, and also many more questions on how to continue moving ahead with the population and development agenda in the region. We're truly very enthused with this very resounding reaffirmation of the countries as to this relevance of the conference as a way of intergovernmentally regulate population and development. This is the guiding light in our actions. And so we, as an organization, we are committed to this. And also we take note that the agreements reached reflect the relevance of drafting national reports on progress made in implementing the Montevideo Consensus. And for this, as we have always done, we will be at the service of countries. In 2023, during the celebration of the 10th anniversary of the conference and the consensus, this is an excellent opportunity to once again exchange about the progress and challenges of all themes related to population and development. 2023 will also be the time when we draft a regional report within the framework of Cairo 2024, and when we once again hope that Latin America and the Caribbean may express within the global context, as on other previous occasions, very soundly and unitedly in defense of an advanced and progressive agenda for development with special emphasis on leaving no one behind. So we congratulate once again the plurinational state of Bolivia for having reached the chair in this election. We also thank the outgoing chair, Peru, and congratulate everyone in the presiding offices. And also we thank ECLAC for the possibility of continuing with this partnership and that we continue to build on based on the mandate given to us by this conference. We are all very proud of the Montevideo Consensus, and which we have taken as the instrument that changes the historical root of this region. But consensus in itself will really be useful when this becomes our collective destiny. Thank you. Before closing the meeting, with the authorization of Harold, I would like to share with you some news because there will not be another opportunity. We know that Harold is leaving. This is his last population conference, And so we would like to thank him for all his commitment, his effort, on behalf of everyone at UNFP, but well, he's come to the 4th. He will be surely at the 5th, but in another function. So Harold, thank you very much for everything.
Bueno, entonces para cerrar.
Well, and to close, the Chair, David Guayachaya, Vice Minister for Planning of Bolivia, and the Chair of the conference. Thank you. Our greetings to Raul Garcia Buchaco, Deputy Executive Secretary of ECLAC, Harold Robertson, Regional Director for Latin America and the Caribbean of UNFP, Luis Yañez, the Secretary for the Commission, Simone Cecchini, Director of CELADE, and authorities of the delegations attending, representatives of the civil society, representatives of international agencies, academia, and officers, sisters, and brothers. We have been walking 9 years along the path marked by the Montevideo Consensus, guided by the priority measures and the wishes of the whole region to achieve better lives for our population. In 2013, the Montevideo Consensus was formed as a contribution to the Cairo Action Plan after 2014 and the agenda of the United Nations for Development after 2015. In the second meeting of the Regional Conference on Population and Development, the operational guide for the implementation and follow-up of the Montevideo Consensus was presented. The third meeting, the countries presented their reports, voluntary reports on a national progress in implementing the consensus, and that showed not only the light of the progress, but also identified the shadows of the challenges. And then we saw the pandemic of COVID-19, but there was Peru that led the presiding officer in times of the pandemic with an outstanding task in holding a series of online dialogues and adapting to the challenges posed by the pandemic in order to promote reflection and analysis of the impact of COVID-19 from the viewpoint of population and development. Thank you, Peru. Thank you, ECLAC, who had effective support in all of these activities. And at this fourth meeting, we highlight the presentation by the Secretariat on the socio-demographic impact of the COVID-19 pandemic in our region, and that offers an outlook of the impact of the pandemic on our people. And likewise, we highlight the virtual platform for regional follow-up of the Montevideo Consensus, and so our countries will commit to its regular update. After 3 days of very intense work, we've come to the closing session of the fourth session of the Regional Conference on Population and Development in Latin America and the Caribbean. And over these 3 days, we've analyzed the socio-demographic impact of the COVID-19 pandemic in our countries and identified the challenges posed by the health crisis for the implementation of the Montevideo Consensus on Population and Development. And in the presentations by countries, it was possible to see that we've all gone through very difficult times as a result of the pandemic, and that put at risk the progress achieved in implementing the priority measures of the consensus. However, we have also been able to take different measures and actions in response in the area of economy, health, among others. and that have allowed us to recover the path marked by the Montevideo Consensus. We've learned that all actions implemented in the region as a result of the pandemic and recovery of the economy seek to leave no one behind. And we highlight these studies carried out on the behavior of the pandemic in order to take decisions to protect the population, especially the most vulnerable, and to buy and distribute vaccines, giving priority initially to health staff, the elderly, and persons with existing conditions. Several countries of the region are today with their booster vaccines and voluntary and free of charge. And also we highlight a rejection for violence against women, a reality present throughout the region, and that demands immediate response, doubling efforts by our governments. Likewise, mitigate the economic crisis of families in times of the pandemic through cash transfer programs, overcome the digital gaps during the time of the pandemic and supporting especially the poorest population groups, improving public systems for health care, increasing hospital beds, intensive care units, and health staff to care for COVID-19 patients with few resources, and attend to the needs of women, girls, boys, youth, Afro-descendants, indigenous people, and people with disability in general. The pandemic posed major challenges in the region in order to achieve the priority measures of the consensus, and especially those directed at the most vulnerable groups that suffered the most with the pandemic. And in the region, there are countries that have carried out censuses, and others are in the process of doing so very soon, which will allow us to have information in order to direct public policy for the benefit of the population. We can say that the objectives of this meeting were met. And at this fourth meeting, 9 years after the first of the Regional Conference on Population and Development in Latin America and the Caribbean, Bolivia receives the baton and with great respect, thanks, and commitment takes on the chair of presiding officers, a task that we will fulfill with the greatest responsibility in coordination with CELADE as the technical secretariat, and with the support by all of you. We hope to move ahead towards meeting the aims and the challenges implied by the Montevideo Consensus. Our main aim will be to forward the agreements of the consensus, the progress of which was seriously affected by the devastating effect of the pandemic. And so therefore, we would like to strengthen and promote the implementation of specific actions to respond or care for the most vulnerable groups, girls, boys, women, persons with a disability, the elderly, indigenous population, Afro-descendants, migrants, among others. And finally, I would like to congratulate all countries taking part, civil society, academia, UN system agencies for their reports and contributions made at this event. Thank you, ECLAG, for your hospitality. We have felt at home. I thank you, brothers and sisters. A big round of applause for everyone for the work carried out, and we see you in 2023.
Clausuramos el evento.
So we close this ceremony, this conference.
Seguimos.